Bismillahirrahmanirrahim. Mohon izin Bapak Ibu, kita akan memulai kegiatan pagi ini. Bagai awal pamulokato, sipatan rundiang pandahuluan, sambah taujak kaundangan, salam tatunggang kaba anjangan, kaganti bajawe tangan. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Welcome to the third International Conference, Policy on Protection of Children and Vulnerable Groups in COVID-19 Pandemic at Saturday, 11 December 2021. It's being a great honor for me to welcome every one of you here in a Zoom meeting. Okay, let me introduce myself first. My name is Revini Lamsari from Health Ministry Polytechnic of Padang. Ladies and gentlemen, before we come to the agenda of the day, we would like to express our sincere gratitude to the Excellency Haji Mahyildi Ansarullah ST, the Governor of West Sumatra. And next, the Honorable Dr. Sugianto M.Ed SG, the Head of Education Center and Health Human Resources of Ministry of Health. The Honorable Dr. Burhan Musim MSI, the Director of Health Ministry Polytechnic of Padang. And the Honorable, our distinguished speaker, Professor Dr. Khatijah Abdullah, PhD from Malaysia, Edwin Auditor, PhD from Manila, Philippines, Dr. Kularat Hauhan, PhD RN from Thailand, and next, Gita Nirmalasari, MK, PhD from Japan and Health Ministry Polytechnic of Jakarta 3, and next, Dr. Adang Bahtiar from University of Indonesia. And next, Mangsin Rivianto SKM MSI from Health Ministry Polytechnic of Padang, Indonesia. Next, the distinguished of our moderator, participants, guests, ladies and gentlemen. Next, ladies and gentlemen, for the first, let's sing the national anthem Indonesia Raya together. Ladies and gentlemen, please rise. Ladies and gentlemen, please have a seat. Next, Poltekkes Padang, hymn song. The Excellency, distinguished participants, ladies and gentlemen, next the recitation prayer, led by Muhammad Tori.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Allow me to lead the prayer for those who are Muslim. For those other than Islam, please adjust. Alhamdulillahi Rabbil Alamin. Alhamdulillahi Rabbil Alamin. Alhamdulillahi Rabbil Alamin. الصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وأصحابه رسول الله أجمعين. اللهم اغفر لي ولوالدي وارحمهم كما ربونا صغارا ولجميع المسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منهم والأموات إنك أنت السميع قريب مجيب دعوة ويا قاضي الحجار. اللهم إنا نسألك سلامة في الدين والعافية في الجسد وزيادة في العلم وبركة في الرزق وتوبة قبل الموت ورحمة عند الموت ومغفرة بعد الموت. اللهم هون علينا في سكرات الموت والنجنة من النار. Ya Allah, Ya Ghafur, forgive our sins, the sins of our parents, the sins of our teachers, and the sins of our predecessors. Ya Allah, Ya Karim, today we are holding an international seminar, so bless and make our event success from the beginning to the end. Ya Allah, I hope this international seminar can be useful for all of us. Amin, amin, ya Rabbal Alamin. ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين. السلام عليكم ورحمة الله وبركاته.
Waalaikumsalam warahmatullahi wabarakatuh. The Excellency, the distinguished guests and participants, ladies and gentlemen. Next, let's listen the report of the chairman of the committee, to Ibu Dr. Yulifa SSIT MKes.
Okay. Thank you, Ms. Revi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
The Honorable Director Health Polytechnic Ministry of Health of Padang. The Honorable Head of the Indonesian Health PPSDM. The Honorable Governor of West Sumatra Province. The Honorable guest speaker from 5 countries, including Dr. Adam Bakhtiar, MD, MPH, DSC, University of Indonesia, Profesor Khatijah Abdullah, PhD, Sunway, University Malaysia, Edwin Auditor, CTP, BSc, MSc, PhD, Philippine Normal University Manila, Dr. Hularat Hauharm, PhD, RN, Praboro Maharaj Chanok Institute, Thailand, Gita Nirmalasari, SST, MCAT, PhD, Osaka University, Japan, and Health Polytechnic Ministry of Health of Jakarta 3. Muksin Riviwanto, SKM, MSA, the head of Center of Excellence, Health Polytechnic Ministry of Health of Padang. The Honorable all conference participants who participate in our activities today. The Honorable all the committees who have packaged this activity well. Ladies and gentlemen, This international conference activity is the third conference activity held by Health Polytechnic Ministry of Health of Padang. The theme of this year's conference is Policy on Protection of Children and Vulnerable Groups in COVID-19 Pandemic. The activities of this conference, a collaboration between the Center of Research and Community Service, the Center of Excellence for Science and Technology, Health Polytechnic Ministry of Health of Padang, and health professional organization in West Sumatra Province. This conference activities consist of three form activities involved scientific seminar to be delivered by speakers from 5 countries, Indonesia, Malaysia, Philippines, Thailand, and Japan. The seminar is carried out in 2 sessions, where the first session of the seminar material presentation will be delivered by 3 speakers, namely Dr. Adang Bakhtiar, with the sub-theme Policies of Health Vulnerable Group Protection during the COVID-19 pandemic. Professor Khatijah Abdullah, PhD, with the sub-theme The Role of Interprofessional Health Collaboration in Protecting Children and Vulnerable Groups from the COVID-19. Edwin Auditor, with the sub-theme Children Protection Law and Policies during the COVID-19 pandemic. On the first session, the presentation of the seminar material will be moderated by Dr. Gusnedi STP NPH. For the second session, the presentation of the material will be delivered by 3 speakers, namely Dr. Hularat Hauham, with the sub-theme Handling of Child Exploitation during COVID-19 Pandemic. Gita Nirmalasari S, with the sub-theme COVID-19 Prevention and Management among Women and Vulnerable Groups with HIV/AIDS. Muksin Riviwanto with the sub-theme The Role of the Center of Excellence for Science and Technology in Mitigating and Adapting to COVID-19 Pandemic. For the second session, the presentation of the seminar material will be moderated by NS Wahimi SKP NCAP. The next activity is oral and poster presentation that will be held in the Design Zoom meeting room. Ladies and gentlemen, participants come from academic, state and private university, practitioner and university students. I hope this conference will run smoothly and all who participate in this activity will enjoy and be comfortable following the activity until it is finished. May we all be under the protection of Allah Subhanahu wa Ta'ala. Amen. Thank you to all the committee members who have prepared everything. Sorry for wrongdoing in the submission of this report. Thank you very much for your attention. Greeting healthy for we all. Thank you.
Thank you for the report from the chairman of the committee. Next, ladies and gentlemen, we would like to invite Dr. Burhan Muslim SKM MSI, the Director of Health Ministry Polytechnic of Padang, to deliver the welcoming speech. Ladies and gentlemen, please welcome Dr. Burhan Muslim, the Director of Health Ministry Polytechnic of Padang.
Terima kasih. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin wassalatu wassalamu ala asrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajmain. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah. Allahumma shalli ala Muhammad wa ala ali Muhammad. Yang sama-sama kita hormati Bapak Gubernur Sumatera Barat yang dalam hal ini diwakili oleh Pak Kepala Dinas Kesehatan Provinsi Sumatera Barat. Kemudian yang sama-sama kita hormati Bapak Kepala Pusat Pendidikan Tenaga Kesehatan Badan PPSDM Kesehatan. Yang sama-sama kita hormati Bapak dan Ibu narasumber. Dan sama-sama kita hormati para panitia dari berbagai organisasi profesi Dan yang sama-sama kita banggakan adalah para peserta seminar yang hadir secara langsung maupun melalui daring. Pertama-tama mari kita bersyukur kepada Allah Tuhan Yang Maha Esa. Alhamdulillah hari ini kita dalam keadaan sehat walafiat. Kemudian salawat beserta salam pada junjungan kita Nabi besar Muhammad Sallallahu Alaihi Wasallam. Allahumma salli ala Muhammad wa ala ali Muhammad. Bapak dan Ibu yang saya hormati, pada kesempatan ini pertama-tama saya ingin menyampaikan ucapan terima kasih kepada panitia yang telah menggagas acara yang sesungguhnya sangat penting bagi sebuah perguruan tinggi, yaitu seminar internasional yang melibatkan peserta dan pembicara dari beberapa negara. Kegiatan seperti ini memang harus kita kembangkan ke depan, karena ini merupakan salah satu bentuk publikasi dari hasil-hasil pemikiran dan hasil-hasil penelitian yang dilakukan oleh para dosen, mahasiswa, dan tenaga pendidikan yang dikomunikasikan melalui media seminar internasional. Dengan demikian, maka kegiatan seperti ini akan memacu kita untuk lebih meningkatkan kemampuan dalam menulis dan berbicara. Sekali lagi saya ucapkan terima kasih kepada panitia yang telah menggagas acara ini. Kemudian ucapan terima kasih juga kami sampaikan kepada seluruh narasumber dari Malaysia, dari Thailand, dan dari Filipina, dan juga ya dari dalam negeri, dari Universitas Indonesia, dari Poltekkes Jakarta 3, serta dari Poltekkes Kemenkes Padang sendiri. Kemudian kepada seluruh peserta, kami ucapkan selamat datang ya, di Poltekkes Kemenkes Padang. Mungkin sebagian besar saudara adalah alumni dari Poltekkes Kemenkes Padang. Karena itu kami harapkan saudara-saudara dapat terus mendukung perkembangan Poltekkes untuk ke depan. Sebagai alumni, sebagai mitra kerja, nah tentu pemikiran-pemikiran dan masukan-masukan untuk kemajuan Poltekkes Kemenkes Padang sangat dibutuhkan. Bapak Ibu yang saya hormati, saya kira demikian yang dapat saya sampaikan. Mohon maaf karena saya menyampaikan dalam bahasa Indonesia, karena memang itu yang lebih pas yang ingin saya sampaikan. Terima kasih. Selamat berseminar. Assalamualaikum warahmatullahi wabarakatuh. Udah.
Thank you, ladies and gentlemen. And
Pak Gubernur mana, Pak? Pak Gubernur.
okay. And next, the Excellency, distinguished participants, ladies and gentlemen. Next,
Maaf dulu, Bu Revi, maaf. Ini
yes.
kan informasi. Selamat datang Pak Gubernur. Tadi informasi ke sampai saya masih Pak Kadis. Maaf Pak, tadi Kak tersapa.
Okay. Thank you. Terima kasih Pak Burhan Muslim as the Director of Padang Health Polytechnic. And ladies and gentlemen, next let's see the video speech of the Head of Education Center and Health Human Resources of Ministry of Health, Bapak Dr. Sugianto, SPD, MFSC.
Assalamualaikum warahmatullahi wabarakatuh. To the Honor Governor of West Sumatra, Director of Poltekkes Kemenkes Padang, with all the staff, the international and Indonesian guest speakers, all participants. First of all, let us offer our gratitude to God, the One and Almighty, for His blessings and guidance that we can gather in this event. In the third international conference with the theme Policy and Protection of Children and Vulnerable Groups in COVID-19 Pandemics. I appreciate and thank to the Director of Poltekkes Kemenkes Padang and the board, also the speakers from University Respati Yogyakarta, University 11 Maret, Poltekkes Kemenkes Bengkulu, Sorong, Semarang, and Poltekkes Kemenkes Padang. Thank you very much for the time and effort spent on organizing this conference. Next, I would like honor all the attendees of this virtual conference. Ladies and gentlemen, in the COVID-19 pandemic situation, there are several groups that are affected more significantly than the general population. These effects range from health, economic, to social exclusion problems as a result of the COVID-19 pandemic. Those groups are children and what we could call the vulnerable group. Included in these vulnerable groups are women, persons with disabilities, the elderly, and the informal sector workers. Various data have shown the significant negative effects of the pandemic on the children and these vulnerable groups. Firstly, it could be denied that the children are very important for the nation's future. But the data shows that in Indonesia, positive COVID-19 cases in the child age group are increasing, reaching around 11 to 12%. COVID-19 cases in children in Indonesia are among the highest cases in the world. This need to get very serious attention from parents, educators, as well as teenagers and other concerned parties. There needs to be more sensitive testing applied to children so that COVID-19 cases could be detected more thoroughly. The next would be the vulnerable group, and the first one are the women. In the COVID-19 pandemic situation, more women are left behind in accessing public services, education, health, and other aspects. The next, vulnerable groups and people with disabilities. According to Susanas data in 2019, around 9% or about 23.3 million Indonesians are people with disabilities. They not only face huge economic and financial risk, but also face major challenge in accessing health, education, and social protection facilities. This makes them more economically fragile, especially during the COVID-19 pandemic. The elderly is the next vulnerable groups. They are greatly affected economically and socially due to the significantly limited mobility during this pandemic. 2020 data from the NP2K shows that more than 80% of the elderly still do not have access to minimum income or pension assistance. Another highly vulnerable group is the informal sector workers. The International Labor Organization defines the informal economy sector as all economic activities by workers and economic units which are not adequately covered in law or in practice by formal arrangement. Bapak Ibu, ladies and gentlemen, even though the groups we mentioned before are vulnerable, those groups are also the pillars of this nation. Therefore, it is important for us who hold a stake in this nation to lend our hands to them. We could do this by providing helpful policies or services that intervene daily to their daily lives and help them both in short term and the long term. This meeting is the right momentum to provide solutions to those problems. For that, once more, I say thank you to the team of experts who have been willing to come to give us the opportunity to learn. I also encourage Poltekkes Kemenkes Padang and its Center of Excellence to further explore collaboration with higher education and other institutions to hatch creative initiatives and products that can improve healthcare in Indonesia, especially regarding this topic about vulnerable groups. Bapak Ibu sekalian, terima kasih. Mudah-mudahan kegiatan webinar ini sukses dan bermanfaat untuk kita semua. I conclude my remarks and hope that the third international conference with the theme Policy and Protection of Children and Vulnerable Groups in COVID-19 pandemic goes well and fulfills its objective. Hopefully, what we do as a learning effort in the development of higher health education institution can provide optimal results. Keep being healthy, keep being spirited, and let us continue to innovate in healthcare. Terima kasih, sukses untuk kita semua, tetap sehat. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for Bapak Dr. Sugianto, SPD, MFSC. The Excellency, distinguished participant, ladies and gentlemen. Next, we would like to invite the Excellency Bapak Haji Mahyildi Ansarullah SP, the Governor of West Sumatra, to deliver a speech as the keynote speaker for this morning. Ladies and gentlemen, please welcome Bapak Haji Mahyildi Ansarullah SP, the Governor of West Sumatra.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Alhamdulillah, asyhadu an la ilaha illallah wa asyhadu anna Muhammadar Rasulullah sallallahu alaihi wasallam la nabiyya ba'da. Selanjutnya, saya mohon maaf karena untuk penyampaian pada pagi hari ini saya gunakan dalam bahasa Indonesia. Yang sesama kita hormati, Bapak Dr. Sugianto, SPD, MAPSC. Selanjutnya yang kita hormati, Bapak Direktur Poltekkes, Bapak Dr. Burhan Muslim, SKM, MSc. Selanjutnya yang kami hormati, para narasumber yang akan berbagi dengan kita dalam The SID International Conference ini. Baik yang dalam negeri ataupun juga ada di luar negeri. Yang tadi kami dengar juga ada dari Filipina, dan juga dari Malaysia, dan kemudian juga dari Indonesia, dan juga negara yang lain. Dan spesial untuk panitia tentunya, yang telah mempersiapkan segala sesuatu, sehingga The SID International Conference dengan tema Policy on Protection of Children and Vulnerable Group in COVID-19 Pandemic ini yang saya kira suatu hal yang luar biasa yang dilakukan oleh Poltekkes dengan panitianya, dengan menghadirkan para narasumber yang luar biasa dalam dan luar negeri. Dan kemudian selanjutnya kepada para peserta yang telah tergabung di dalam webinar ini. Di Sumatera Barat, penanganan COVID-19 itu telah kita hadirkan melalui Perda nomor 6 tahun 2020, yaitu adaptasi kebiasaan baru. Dan dalam penanganan dan pengendalian COVID, di samping juga dengan adanya pedoman-pedoman yang dihadirkan melalui kementerian dan juga dari daerah, maka tentu ini akan menjadi bagian yang menjadi dasar pedoman kita di dalam menyikapi dan menghadirkan kebijakan-kebijakan dalam rangka untuk memberikan perlindungan dan pencegahan kepada anak ataupun juga kepada kelompok rawan pada masa pandemi ini. Karena kita mengetahui bahwasanya COVID-19 telah menyebabkan pembatasan-pembatasan kepada kita di dalam pengendalian. Jadi kita tidak bebas untuk bergerak, beraktivitas. Ya. Kenapa? Karena memang COVID-19 menyebabkan kita ada pembatasan-pembatasan. Ya. Di antaranya seperti yang sudah sama kita ketahui, menjaga jarak. Nah, sehingga ini tentu ini akan ada pembatasan. Dan kemudian juga tidak boleh kita berkumpul menghadirkan jumlah yang banyak. Ya. Nah, tentu ini akan menyebabkan kita tidak leluasa di dalam bergerak. Nah, maka soal itulah di dalam peraturan-peraturan yang ada dan juga kita tuangkan dalam perda, maka kita sesuaikan dengan pembatasan-pembatasan tersebut. Apalagi sampai sekarang pun juga kita belum ada jaminan bahwasanya COVID ini akan hilang sama sekali. Ya, karena memang belum ada, sepengetahuan kami, ilmu untuk menghilangkan virus itu belum ada. Membunuh virus itu belum ada. Virus itu tetap ada. Ya, dan dia tetap berkembang. Dan bahkan sekarang ini kita dengar itu dia melakukan penyesuaian-penyesuaian dengan situasi kondisi yang ada. Dengan hadirnya varian-varian baru gitu. Nah, maka itu memang kitanya lah yang harus melakukan perubahan-perubahan pada diri kita. Ya, tentu adalah dengan meningkatkan ketahanan tubuh kita. Ya, meningkatkan bagaimana cara kita menghadapi pandemi ini. Nah, khusus untuk anak-anak dan kemudian juga kepada kelompok rawan, tentu di sini adalah para orang tua tentunya. Ya. Maka kalau saya itu modifikasi yang kita lakukan adalah dengan melakukan upaya dari tenaga kesehatannya untuk melakukan dan mengunjungi kelompok tersebut. Katakanlah mungkin kepada anak-anak, tentu posyandunya itu yang dulu di dalam kaitan posyandu itu adalah bagaimana orang tua bersama dengan anaknya datang ke tempat yang kita sediakan. Nah, sementara sekarang ini itu ada pembatasan-pembatasan, dan bahkan juga ada di antara sebagian masyarakat kita juga masih khawatir. Seperti kelompok rentan misalnya, itu sangat khawatir sekali ketika mereka berada di luar juga akan terkena COVID tentunya. Nah, maksud itu memang dari petugas kesehatannya lah, dari pemerintahnya lah yang lebih proaktif untuk menggerakkan dan untuk mengedukasi ya kelompok-kelompok masyarakat tadi, ya terutama sekali adalah kelompok yang rentan tentunya. Nah, dalam hal ini adalah ada edukasi dan ada konseling gizi ya yang kita lakukan secara langsung dengan mengunjungi mereka. Nah, kemudian yang terpenting lagi tentu adalah melalui media penggunaan IT tentunya. Ya, itu dengan seperti yang kita lakukan pada hari ini adalah dengan webinar, pesan sampai, dan kemudian kita tidak berdekatan, begitu. Nah, inilah yang memang harus kita lakukan. Jadi ada kunjungan yang memang dilakukan oleh tenaga kesehatan kita, dan kemudian kita mengoptimalkan potensi-potensi IT dalam rangka untuk mengedukasi, dan juga dalam rangka untuk memberikan penyuluhan-penyuluhan kepada mereka. Nah, khusus untuk yang punya resiko tinggi, memang kunjungan rumah lah yang harus kita lakukan. Dan kami juga terima kasih kepada tenaga-tenaga kesehatan dari rumah sakit, bahkan dokter-dokter spesialis, pada saat sekarang ini itu langsung turun ke lapangan, ke nagari-nagari, ya, ke puskesmas-puskesmas, untuk mengedukasi masyarakat, dan untuk memberikan penyuluhan-penyuluhan kepada masyarakat. Nah, kalau saya itu dalam hal ini memang peran daripada tenaga kesehatan ya ini adalah menjadi bagian yang sangat-sangat vital dalam rangka untuk mengedukasi, dalam rangka untuk memberikan pesan-pesan melalui webinar ataupun juga melalui diskusi secara daring tentunya. Nah, kita pun di pemerintah juga mendorong ke arah yang demikian. Ya, seperti memang pemantauan yang kita lakukan terhadap balita di puskesmas dan posyandu, dan kemudian kita langsung ke rumah-rumah masyarakat, ya, dan sekarang ini kita juga melibatkan melalui tenaga-tenaga yang ada di RW, di RT, ya, di nagari, ya, melalui PKK-nya, ya, melalui tenaga kesehatannya yang ada di bawah PKK, dan kemudian juga PKK di kabupaten kota dan di kecamatan. Ini kita berdayakan, ya. Dan termasuk juga untuk mengedukasi dalam rangka untuk meningkatkan daya tahan dengan mengkonsumsi makan makanan ataupun juga ada permakanan tambahan yang kita berikan. Jadi saya kira barangkali mungkin untuk ke depan, karena pembatasan-pembatasan yang tetap harus kita jaga, ya, protokol kesehatan itu, maka itu dengan adanya konferensi internasional ini, ya, kita harapkan ke depan dukungan daripada tenaga kesehatan dari mahasiswa-mahasiswa yang berada di sekolah-sekolah kesehatan, ya, tentu adalah sangat-sangat kita harapkan dalam rangka untuk mengedukasi, dalam rangka untuk memberikan penyuluhan, dan kemudian juga dalam rangka untuk melakukan pendekatan kepada masyarakat. Apalagi pada saat sekarang ini kita juga konsen untuk melakukan vaksinasi, ya, yang capaian kita di Sumatera Barat pada saat ini, ya, alhamdulillah sekarang ini sudah mendekati 60%, ya, 57, 58 kisaran demikian. Nah, mudah-mudahan insya Allah pada akhir Desember ini kita bisa mencapai 70% untuk pelaksanaan vaksin kita. Karena memang dalam rangka untuk pencapaian dan kemudian dalam rangka untuk maksimalkan vaksin ini, maka kita butuh tenaga vaksinator, kemudian juga tenaga kesehatan untuk mengedukasi dan kemudian untuk mengingat kepada masyarakat. Nah, mudah-mudahan dengan menghadirkan narasumber yang sudah berpengalaman di banyak negara pada kesempatan ini, mudah-mudahan ini akan menjadi bagian dalam rangka untuk penyempurnaan langkah-langkah yang kita lakukan di Indonesia umumnya dan Sumatera Barat khususnya. Dan mudah-mudahan Poltekkes ke depan menjadi tenaga perguruan tinggi yang konsen untuk bersinergi dengan pemerintah ataupun juga dengan pihak-pihak lainnya dalam rangka untuk menekan COVID-19 ini di masa-masa mendatang. Sukses untuk konferensi internasional yang ketiga ini, dan mudah-mudahan penanganan COVID di Sumatera Barat Indonesia akan lebih baik di masa-masa mendatang. Demikian dari kami, mohon maaf terlebih terkurang. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thanks to Bapak Haji Mahyildi Ansarullah SP, the Governor of West Sumatra. Well, the Excellency, distinguished participants, ladies and gentlemen, we come to the end of the opening ceremony, the third International Conference, Policy on Protection of Children and Vulnerable Groups in COVID-19 Pandemic. We would like to say thank you to the Governor and also all the participants. Sairang balam Jawaraba, pucuk cimpagorang patahkan. Sairang salam saratus sambah, terima kasih kami ucapkan. Akhir kata, wabillahi taufiq wal hidayah, wassalamualaikum warahmatullahi wabarakatuh. Terima kasih Bapak Gubernur.
Mana? UMP kan? Terima kasih. Kalau undangannya jam 9:30, tapi konfirmasi tadi benar sampai jam 9.
Well, ladies and gentlemen, next we come to the video profile of Poltekkes Kemenkes Padang.
Teknik Kesehatan Kementerian Kesehatan Padang merupakan salah satu pendidikan tinggi yang menyelenggarakan pendidikan vokasi kesehatan milik Kementerian Kesehatan yang ada di Provinsi Sumatera Barat. Politeknik Kesehatan Kementerian Kesehatan Padang berdiri berdasarkan SK Menteri Kesehatan dan Kesejahteraan Sosial nomor 298 tahun 2001. Merupakan gabungan dari 7 akademi kesehatan di Sumatera Barat.
Selamat datang di Poltekkes Kemenkes Padang, satu dari 38 Poltekkes milik Kementerian Kesehatan yang ada di Indonesia. Poltekkes Kemenkes Padang memiliki visi menjadi institusi pendidikan yang berdaya saing, inovatif, prestatif, dan bertakwa kepada Tuhan Yang Maha Esa.
Misi 1. Menyelenggarakan pendidikan vokasi dan profesi yang inovatif berlandaskan ketakwaan kepada Tuhan Yang Maha Esa. 2. Menyelenggarakan penelitian terapan yang berdaya saing untuk menunjang pembangunan dan pengembangan iptek kesehatan. 3. Menyelenggarakan pengabdian masyarakat dalam memecahkan masalah kesehatan masyarakat. 4. Mengembangkan tata kelola organisasi yang baik dalam memberikan pelayanan yang prima. 5. Menjalin kerjasama yang berdaya guna dan berkelanjutan dengan lembaga pendidikan tinggi, pemerintah, dan swasta di tingkat daerah, nasional, dan internasional. Politeknik Kesehatan Kementerian Kesehatan Padang memiliki 6 jurusan dan 12 program studi Diploma 3, Diploma 4, dan saat ini sedang mempersiapkan Prodi Profesi Bidan, Prodi Diploma 4 Keselamatan dan Kesehatan Kerja, serta Prodi Diploma 4 Keperawatan Gigi yang didukung oleh 6 dosen berkualifikasi doktor. Berdasarkan surat keputusan Direktur nomor LB.0053.0053.2.2014 tanggal 7 Januari 2014 tentang kebijakan kebebasan akademik, kebebasan mimbar akademik, dan otonomi keilmuan Poltekkes Kemenkes Padang memayungi sivitas akademika berinteraksi di dalam maupun di luar kelas untuk pengembangan perilaku kecendekiawanan. Assalamualaikum warahmatullahi wabarakatuh. Poltekkes Kemenkes Padang sudah melaksanakan sistem penjaminan mutu internal. Dalam pelaksanaan Tridharma Perguruan Tinggi, kami telah mengimplementasikan Standar Nasional Pendidikan Tinggi dan standar yang ditetapkan oleh Poltekkes Kemenkes Padang, sehingga proses pembelajaran, penelitian, dan pengabdian kepada masyarakat sudah berjalan dengan baik. Dengan terlaksananya sistem penjaminan mutu internal pada Poltekkes Kemenkes Padang, sehingga kami sudah dapat mencapai target indikator kinerja utama, yaitu lulus tepat waktu 97,72%, lulus dengan indeks prestasi kumulatif di atas 3 99,55%, lulus uji kompetensi 94,4%, dan masa tunggu lulusan di bawah 6 bulan sudah mencapai 60%.
Assalamualaikum warahmatullahi wabarakatuh. Kegiatan Tridharma Perguruan Tinggi di Poltekkes Kemenkes Padang ditopang dengan dana yang berasal dari 2 sumber. Yang pertama adalah dana yang berasal dari masyarakat berupa penerimaan negara bukan pajak atau PNBP, serta yang kedua dana yang berasal dari pemerintah, dalam hal ini Kementerian Kesehatan dalam bentuk rupiah murni. Anggaran ini kita gunakan adalah untuk pembelanjaan berbagai kebutuhan di dalam proses belajar mengajar dan Tridharma Perguruan Tinggi lainnya, seperti untuk pengadaan sarana dan prasarana pembelajaran, untuk pemeliharaan sarana dan prasarana pembelajaran dan pendidikan, kemudian untuk pembelian bahan-bahan praktek bagi mahasiswa di laboratorium, untuk pelaksanaan penelitian bagi dosen dan tenaga pendidikan, serta pelaksanaan kegiatan pengabdian masyarakat. Di samping juga kita belanjakan untuk kebutuhan-kebutuhan penunjang pendidikan lainnya. Pengelolaan anggaran di Poltekkes Kemenkes Padang kita laksanakan secara kredibel, akuntabel, dan transparan sesuai dengan aturan-aturan yang berlaku serta perundang-perundangan yang ada.
Auditorium mampu menampung 1.500 orang. 2 unit asrama memiliki kapasitas 72 tempat tidur. Memiliki kendaraan roda 6 dan roda 4 yang siap menunjang pelaksanaan tridharma perguruan tinggi bagi sivitas akademika. Dosen Politeknik Kesehatan Kementerian Kesehatan Padang melaksanakan pengembangan pendidikan dan penelitian ke dalam pengabdian kepada masyarakat dengan melibatkan mahasiswa. Politeknik Kesehatan Kementerian Kesehatan Padang melaksanakan kerjasama dengan institusi dalam dan luar negeri yang bertujuan untuk menunjang pendidikan dan pembelajaran praktik serta membantu penyerapan lulusan pada dunia kerja.
Poltekkes Kemenkes Padang dalam upaya meningkatkan animo masyarakat untuk memilih Poltekkes Padang telah dilakukan dengan berbagai upaya. 1. Melalui sosialisasi dan promosi menggunakan berbagai media massa dan media sosial lainnya dengan mengikut sertakan organisasi mahasiswa. Selanjutnya, upaya yang telah dilakukan Poltekkes Kemenkes Padang dalam meningkatkan mutu lulusan dengan melakukan berbagai pelatihan soft skill, pelatihan kewirausahaan, pelatihan sesuai dengan keilmuan di jurusan, pelatihan tes TOEFL maupun pelatihan yang melibatkan jejaring alumni, serta kita juga bekerja sama dengan Dinas Depnaker untuk pengiriman mahasiswa ke luar negeri. Upaya untuk meningkatkan kerjasama di dalam kegiatan Tridharma Perguruan Tinggi, kita juga telah menjaring kerjasama dengan institusi yang ada di dalam dan di luar negeri, terutama di negara-negara yang ada di Asia.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Saya Sugi Roslan. Saya saat ini bekerja di Pusat Kesehatan Haji Kementerian Kesehatan. Saya adalah salah satu alumni Akademi Kesehatan Lingkungan Padang tahun 1994 dan saya sangat bangga sekali lulus dari Akademi Kesehatan Lingkungan Padang.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi Indonesia dan selamat pagi kepada bapak-bapak, ibu-ibu dosen saya di Poltekkes Padang serta kakak kelas, teman sejawat di mana saja berada, dan juga adik-adik kelas saya. Saya Evi Suryanto. Saya adalah alumni Akper Padang ini 32 tahun yang lalu.
Saya Letnan 2 Kesehatan Fitur yang selaku alumni mengucapkan terima kasih yang sebesar-besarnya kepada Alma Mater Kesehatan Lingkungan Padang dan para dosen atas bimbingannya sehingga seperti sekarang ini. Saya mengajak pada adik-adik mahasiswa agar lebih giat, lebih bersemangat lagi dalam prodi kesehatan lingkungan karena kesempatan bekerja para alumni sangat luas. Saya menunggu kalian bergabung di Kesehatan TNI. Salam Swabwana Paksa.
Warahmatullahi wabarakatuh. Kami Kolonel Korps Kesehatan Militer Irdan Ridwan. Kami adalah alumni angkatan pertama Akademi Gizi Padang tahun 1983. Kami sampaikan hal-hal menarik dalam perjalanan tugas kami. Pertama, kami tugaskan di Satuan Tempur Batalion Kesehatan Kostrat selaku Nutrition Officer dan beberapa kali menjadi Komandan Kompi Lapangan. Kami pernah ditugaskan tergabung di dalam Peacekeeping Force United Nation di Bosnia Herzegovina. Kemudian kami juga pernah menjadi kepala unit gizi RSPAD Ketu Subroto. Kemudian sekarang berubah menjadi instalasi gizi RSPAD Ketu Subroto. Kami yakin peran lulusan gizi ke depan semakin terbuka, baik di kalangan sipil, militer, NGO, dan private business. Saya bangga menjadi alumni Gizi Padang. Jayalah alma materku, Spasta Harena. Wassalamualaikum warahmatullahi wabarakatuh.
Well, ladies and gentlemen, that's the profile of Poltekkes Kemenkes Padang. And next, the Excellency, distinguished participants, ladies and gentlemen, as our rundown of the day, next agenda is the first panel of this conference. And our moderator is Bapak Dr. Gusnedi. Hello, Mr. Gusnedi.
Hello, Miss Revi. Morning.
Okay. Nice to see you.
Nice to see you too, Miss Revi.
Okay. Please, IT team, can we show the profile of Mr. Gusnedi? Okay. So this is it. The curriculum vitae of our moderator, Bapak Dr. Gusnedi STP MPH. Okay. The additional background, Diploma in Nutrition, Nutrition Academy of Padang in 1993, Bachelor in Food Technology and Nutrition, IPB University, and then Master of Public Health in Community Nutrition, the University of Queensland, Australia. Wow, it's amazing. And Doctor in Nutritional Science in Indonesia University. Well, Mr. Gusnedi, can we start?
Okay.
The time is yours.
Okay. Thank you, Miss Revi, for the nice introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Very good morning, ladies and gentlemen. First of all, we would like to express our sincere gratitude to the Most Excellency, the Head of Education Center and Health Human Resources of Health Ministry, Bapak Dr. Sugianto, SPD, Master Applied of Science, the Governor of West Sumatra, Bapak Mahyoldi Ansarullah, SP, Honorable the Director of Health Ministry Polytechnic of Padang, Bapak Dr. Burhan Muslim, SKM, MSI, Honorable all distinguished speakers, guests, audiences, and organizing committee. Welcome to the first session of the third international conference with the theme Policies of Health Protection of Children and Vulnerable Groups in COVID-19 pandemics. It is a being great honor for me to be the moderator for the first session of today's conference. Before we begin, I have a few housekeeping notes. Today's session is being recorded to be available for viewing post-conference. We will have 3 distinguished speakers in this first session. Each speaker today will have a total of 20 minutes for their presentation. If one of our speakers complete their presentation before their 20-minute presentation is up, there may be time for a question for attendees. However, we will hold most questions until the end of the session, and I will then read question out loud for the presenter to answer as time permits at the end. Before we get started, I would like to introduce the 3 speakers who will be presenting in the next about 1 hour. Our first speaker is Bapak Dr. Adang Bahtiar MD MPH DSC. The IT, would you like to show the slide for the CV of Pak Adang? Okay, or maybe I would like to share my own screen. Okay, let me. Okay. Okay. Right. Our first speaker is Dr. Adang Bahtiar MD MPH DSC. He is currently working at the Center for Health Administration and Policy Study, Universitas Indonesia. Previously, he had several educational background. He took his medical doctor from University of Indonesia, and then Master of Public Health in Health Policy from Harvard T.H. Chan School of Public Health. And then he also had a PhD in International Health from the Johns Hopkins University. And last but not least, he also finished postdoctoral in statistics from University of Michigan. Pak Adang is currently acting as the chairperson of the Department of Health Policy and Management at the University of Indonesia since 2004, quite long. He is also director of the Center for Health Administration and Policy Studies since 2007. He also a chairman of the advisory board, Indonesian Public Health Association from 2016. Okay, now we move to the second speaker from the Department of Nursing School of Medical and Life Science, Sunway University, Malaysia. She is from Professor Dr. Khatijah Abdullah, PhD. She finished her PhD from University of Southampton, United Kingdom. Previously, she got a Master of Science in Health Services Management from University Manchester, UK, Bachelor in Nursing Studies from University of Manchester, Midwifery from Berkshire College of Nursing and Midwifery, Reading, UK. She also got a certificate in special and intensive care for neonates from Bath and Sweden College of Health Study, registered nurse from University of Malaysia, teaching certificate from English Nursing Board, UK. Professor Khatijah is currently a nursing professor and head of Department of Nursing, School of Healthcare and Medical Science, Sunway University, Malaysia. Previously, she has a lot of work experience in management of tertiary educational institution and also actively acted as a very productive author in publishing scientific journal articles, especially in nursing field. Then our third speaker is Edwin Auditor, CTP, BSc, MSc, PhD. He is currently working as an assistant professor at Philippine Normal University, Manila. He has educational background of bachelor degree in teaching physics and math from Philippine Normal University, master in teaching physics from De La Salle University, and doctor of philosophy or PhD in education from the University of Auckland. Okay, ladies and gentlemen, now moving along to our session. Please welcome the first speaker, Dr. Adang Bakhtiar, MD, MPhD, SC, who will be speaking to us on policies of health vulnerable group protection during the COVID-19 pandemic. Hello, Pak Adang. Are you with us now?
Pak Gus. Assalamualaikum. Can you hear my voice?
Okay. It's clear,
Okay,
Pak.
thank you.
Okay.
Thank you.
All right. We will give Pak Adang a 20 minutes presentation, and let me remind you when the time 5 minutes left. Pak Adang, the time is yours.
Thank you, Pak Gus. Allow me to share my PowerPoints, and I will off my video because of the connectivity problem.
Okay, Pak. Okay.
Okay, I hope you can see my presentation at the moment. Pak Gus, can you hear me? Pak Gus Nadi? Or the Master of Ceremony, can you hear my voice?
Yes, it's clear, sir.
Yes, thank you.
Yeah.
So I would like to share my opinion about protecting the vulnerable. And the title is Community Resilience for Protecting the Vulnerable, and what kind of health strategic pathway we need to develop to protect them. So outlines, I would like to share what is actually the VUCA analysis, the acronym of volatility, uncertainty, complexity, and ambiguity. Then after that, we would like to develop the strategic path to protect the vulnerable with the VUCA Prime framework, the acronym of the visioning, understanding, clarity, and agility. Then we understand to the end of this presentation that community resilience is for protecting the vulnerables to stay healthy, secure, and productive. The different factor for that, actually, we have to understand who are the vulnerables during the outbreaks. The definition are those with a greater risk due to older age, occupational risk, social, economic, and other health and life circumstances. And the guidance for them actually is very simple, very clear: vaccination, continuing practices of mask and so forth, continue risk assessment because they are very high risk, and also safe working conditions. But then the next question would be what kind of strategic pathway we should develop to have that to them. So the given factors related to our strategic pathway is the transform national health system that developed by the Bapnas. There are many key strategies in the national health system that they are transformed. One of them is related to technology information and empowering the community. For me, we have to focus to that strategies, other strategies actually to support the very critical strategy, i.e. the technology information and the empowering people. Let's move on to first component of the FUCA analysis for TB and COVID-19 agenda. So for me, I have to include the TB elimination as the part of the protecting the vulnerable Indonesia, simply because first argument related to the same target, the lung target, and secondly, Indonesia is still higher in the global situation related to the tuberculosis. Volatility actually is to examine the health problem situation in terms of prevalence, trends, spread, and the impact of the disease. Then protection for the vulnerable, actually, we need to develop what we call effective synergy as a must. Indonesia, at the new norms condition, have several strategic issues. Infant mortality rate, maternal mortality rate is higher compared to ASEAN countries. The governor actually already mentioned about it. Chronic condition among older ages, we do still have the accessibility, availability, and quality problem of universal health coverage. And as I said, TB is still within 10 highest in the world, according to the TB report 2021. We are number 3, and also we have economic challenge because of the COVID-19. In a norm situation, report from national health authorities, we do have problems of lower level of achievement during pandemic. The governor mentioned specifically about the vaccination, immunization, higher prevalence of TB drug resistance increasing, and COVID-19 cases still high. And we don't know yet when we will finish it, as also mentioned by the governor, our governor at the opening ceremony. So the second component of FUCA analysis is uncertainty. We need to examine the problem-solving effectiveness, and when the more factors related to the issues, the COVID, the vulnerable, then the more uncertain the effectiveness of the solution. Some condition is to have human resources for health problems, beginning from recruitment, placement, training, and so forth. Disparity among local government. Some of them already advanced, some of them still behind. Health financing capacity ever limited because of the COVID-19 impact. Pentahelix role are limited. This is according to the Provincial Health Report 2020. Then impact is community resilience is lowering down, and infodemics, hoax everywhere spread and then become a rule of the game in the COVID situation. The third dimension of the FUCA analysis is the complexity of an issue. COVID-19 is global issues, and many factors are entangled to the situations. One of them is related to the health as a basic needs. And then because of the concept, we understand that many sectors related to health is a basic need to protect them. Housing and family incomes, water supply, education, and so forth. Because of that, then the MOH tagline everywhere, they are saying the very simple health promotion tagline. Kesehatan is not everything. Kesehatan bukan segala-galanya, tetapi tanpa kesehatan, everything is nothing. So if we do consist saying that to everybody, then everybody will understand that health is a basic need and need to be supported by all sectors. We use this diagram simply because we understand that it is not only the health sectors that related to the improvement, degree of health. It is not only this one, but also is related to other factors related to lifestyle, the environmental, and then also the factors related to the biological conditions. Because of that, then we have to understand that if we want to achieve the comprehensive healthy lifestyle, it's not only the physical health, but also mental health and social health, we have to link other missions in even in the village area. What are they? Beginning from the, as mentioned by the government, digitalizing the governance at all levels, connecting to the effort for prevent and detecting and respond at all levels, for empowering all to protect the vulnerable, to achieve the comprehensive health situation. Now we are moving to the fourth dimension of the FUCA analysis, the ambiguity, confusion, and all demotivating factors will certainly affect the success of any intervention. Ambiguity is the key factors to resolve any problems related to protecting the vulnerables. In Latin language, we call it Vox Populi, Vox Dei. Community resilience is the key component to address, to protect the vulnerables. These are examples. You might want just to read it because you can see many other examples to develop the community resilience. So then the strategies we have to develop to protect the vulnerables. We do have 4 dimensions: visioning, understanding, clarity, and agility to develop the health protection responses to the vulnerables. Let's begin to the visioning. What is actually have to have a vision to protect the vulnerable people at the vulnerable segment in the community? We just use the agreement during the Bupati talks, and they agreed that if we want to achieve the social health welfare vision, then we have to understand that we have another vision, including the environmental sustainability vision, the equity vision, and also the modernity visions. Those three visions should support to achieve the social health welfare vision. So then we move to FUCA Prime second dimension, understanding the situation. Then we have to say to everybody, if you want to protect the vulnerables, then we have to say that everybody need to understand they have responsibility to protect their own health and the family and the community. In a simple word, vulnerables' health is everyone's business. From the first prevention activities, second prevention activity, the third prevention activity, the curative, the rehabilitative, and protecting the vulnerables for healthy lifestyles. Some examples you might want to read. We do have already Desa Siaga TB and COVID-19, and their vision actually to develop the health as responsibility of all in the desa, in the village, to protect the vulnerable as a high priority. Healthy housing and environmental. These activities actually developed by the architects organization, Yahintara. That means business sector intervention to help the vulnerables. Community-based patient hospice. Accessibility for the vulnerable sometimes have a very long distance from the healthcare facility. So then the community develop patient hospice to develop the accessibility for the vulnerable. This is another example of what we call the village resilience, called as Perang Akar Rumput for COVID-19, developed in DKI by YAKMI DKI Jakarta, Indonesian Public Health Association in DKI Jakarta. So they develop everything in the village, so they will sustain and resilience from the COVID problems. The next dimension of the FUCA Prime framework is the clarity. If we understand that we do have for vision or our mission, as Bupati agreed, to achieve the health welfare vision, then we have to develop three other visions, three other missions, beginning from clean government mission, economic development, and environmental sustainability. Those missions actually should be developed specific indicators that measure the success. Okay, so then I have to move very quickly because time is very limited. I would like to focus on the agility, the last component of the FUCA Prime. Agility is community readiness for prevent, detect, and respond among the vulnerable, to develop the community empowerment, second dimension of the agility, social support, collaborative leadership, and effective communication to all sectors, not only the health sector, to mobilize all resources. These are the layers to protect the vulnerables, beginning from the family, and then move to the guyub surrounding, which is the RT, the airway, the village, and then the decentralized capacity and the national capacity. Professional support is very critical to develop that, to maintain and develop the community assets, community effort 4. Family resilience, to change the individual behavior of the vulnerables to achieve the goal of healthy life of the vulnerables. So the last things that we have to develop is measure of success. This is very critical. I'm using the collaborative leadership diagram. Everything is or must be developed beginning from the local leader vision, step by step, until we do have the action plan, and then doing the monitoring and evaluation as a cycles. I think that's
Excuse me,
all
Pak
my
Adam,
presentation.
you have 5 minutes left.
Yes, thank you, Bagus. I think I finished my presentation. Yes, this is the last transparent for me. Thank you very much. Give it back to Bagus as the moderator. Thank you.
Okay. Thank you very much, Pak Adam, for addressing the very interesting topic for today. Ladies and gentlemen, next please welcome Professor Dr. Khatijah Abdullah, who will be presenting the role of interprofessional health collaboration in protecting children and vulnerable groups from the COVID-19. Hello, Prof. Khatijah. It's nice to meet you.
Yes, good evening. Assalamualaikum, Dr. Kasnidi.
Waalaikumsalam. Okay, all right. Now it's your turn for the next 20 minutes.
Okay, thank you so much for chairing the panel. First of all, Assalamualaikum and good morning, ladies and gentlemen. First of all, I'd like to congratulate really Health Ministry, Polytechnic of Padang, and health professional organizations, and of course, especially to Professor Dr. Burhan Muslim for actually convening this very exciting conference with the Center of Research and Community Service, Center of Excellence for Science and Technology. So it is my pleasure and my honor to join you guys in this very important session on the role of interprofessional collaborations in protecting children and the vulnerable groups from COVID-19. So before I start, I would like to introduce my country and my university. So basically just a few 1-2 slides only. So let me share my PowerPoint. Oh, wait, how come it, this one? Yeah. I think I have to put it to slideshow. Just give me a second. Yes. Can you see and hear me?
Yes. Yeah, it's clear.
So yeah, it's a mouthful of my title. I'll try to complete it in 20 minutes. So this is where I come from, very near to Indonesia. Welcome to Malaysia. And I'm sure most of you have been to Malaysia, and we look forward to welcome you again, inshallah, next year when the COVID cases are a bit better. Our borders are opening, so inshallah, we can actually have a more collaborative face-to-face meetings. So this is my university. I just joined the university about a year ago. I used to be from University of Malaya. So this is a very young university. I'm very excited about this university because their nursing are actually developing, and we are actually under School of Medical and Life Sciences, one of the 7 schools in the university. So we are ranked about 170, and we are working very hard to improve our ranking as everybody. So do welcome that. So for today, 20 minutes talk, I would like to touch a bit about IPC, interprofessional collaborations, go on to talk about what is happening in Malaysia, particularly for children and women and vulnerable groups, pregnant women, and then talk about how the nurse's role can play in this very worrying pandemic that all of us are facing. So I also would like to disclaim that this is just a summary. There's so much out there, and I encourage all of you to explore it. There's really amazing work done around the world, and that is actually great. So just to refresh our mind, what do we mean by interprofessional collaboration? So interprofessional itself is actually talking about relationship between different professional groups And collaboration basically is partnership. And as we all know, in this changing healthcare environment, we really require not only new norms of work, of living, how we live and how we practice our 3Ws and 3Ps, but also the new ways of working and collaboratively to improve our patient care. And this is particularly important because healthcare is very complex. And then with added pandemic, the coronavirus that nobody expected, and like our previous eminent speaker says, there's a lot of uncertainty in it. And the best way is to work together where we have mutual reciprocal effort together. I think alone, we cannot actually serve our customers best. So we need to work together. So actually, if you look at the WHO, World Health Organization, our biggest health organization in the world, even in 2010, they're talking about 10 years ago, even before pandemic coronavirus hit us, they already encouraged us to talk about studying together, IPE, learning from each other, and also from there, working together with our different strength and limitation. So this is nothing new, really. So why, down 10 years, we're still talking about it? It has been shown that a lot of articles, I'm not going to bore you with it, but it did show that if you have poor interprofessional collaboration, it can lead to very poor outcomes for our patient. So it is a very key factor to increase our effectiveness of the kind of service we actually offered to our patient. Predominantly now we're talking about children and pregnant women and the elderly who are very marginalized and who are very vulnerable. So what about the reports? Again, 10 years ago, well, more than 10 years, in 1999, the Institute of Medicine report to ill is human. I think all of us have read about it, about medication error. Even from that time, it also stressed the need for interprofessional teams to communicate and to collaborate. And the future of nursing 10 years ago also talk about the nurse have to advance into professional collaboration so that we can coordinate and improve patient-centered care. So there's different types of collaboration. We can do what we call the multidisciplinary, where different disciplines comes together. We can interdisciplinary, where we actually integrate ourselves. We can transdisciplinary, where every different sectors actually comes together to actually improve what can be done better. So people say that more heads is better than one head. So that is where collaborations actually works well. Now, I would like to share a very short video, maybe 5 minutes, but I'll stop it in between, about these examples of 3 nurses, right? One is a social worker, one is a dietitian, and one is a nurse, working together to improve a care for a single mom with a 32-weeker baby at home, and the baby is not developing well. So that is where you need the collaborative teamwork to see where each of us can contribute to the care. So let's have a very short break from my voice and let's have a listen to that.
Hi, my name is Christina Katka. I'm a social worker with the Maternal Infant Health Program, which is a home visiting program for pregnant women and infants in Washington County who have Medicaid insurance. My name is Kim Schultz. I'm a nurse. We also have the Maternal Infant Health Program.
And Jennifer Ellsworth, I'm a dietitian with the program.
So a typical day as a social worker in the Maternal Infant Health Program, we all start out, with having a certain amount of visits scheduled for the day, often trying to confirm with the families that we work with. The plan is to see them on a monthly basis. However, we understand that a lot of our families have a lot of different needs, and sometimes those basic needs of maybe getting a ride to the grocery store or someone can take them for a ride somewhere else might trump kind of what our visit might be able to offer. So we do spend a great amount of time of coordinating just to make sure that families are getting what they need. So we can generally schedule 3 visits in a day and maybe realize that we might not actually see those people, but we recognize that they have a lot of different needs, kind of pulling them in different directions. So a lot of it, we might check in the office in the morning, get our visit scheduled, grab all of the paperwork or supplies that we might need. Some families are needing food. We're fortunate that we have a food pantry here that we can pull some resources from. We also have diapers and safety items that we're able to take out to families if that's something that they are in need of. So we might gather those things and then kind of head on our way and potentially be out in our car or in someone's house for the majority of the day. It's not an office job. There's a lot of flexibility to it, but it's also really nice to go into people's neighborhoods, see where they're living, see, kind of what some of the challenges are, so what's the strengths of the neighborhoods, and really help families navigate their community. As far as a nursing role, so you're probably catching as you listen to this video that there's a lot of similarities between the nurse and the social worker. Obviously, we both bring our own viewpoints to the care of the client and our own professional experience and education. Specifically for nursing, although it's not a clinical nursing role, we play babies, we measure babies, we talk a lot about growth and development. I think a big thing for me is explaining the growth chart, because the pediatricians don't necessarily have the time in those doctor's visits, and the nurses, they're tight visits, and we have a little more time with the patient. So a lot of my role is kind of adding on to what maybe the doctor said or the pediatrician said, or what the experience was at the urgent care last weekend. Even liaising with the doctor's office, I think they have a picture of the client when they see the client for a short snippet of time, and then I have a viewpoint of being in the home. So sometimes the doctor might feel a client's being uncooperative and not coming in for visits, where there's sometimes more to that story. That's kind of the social determinants of health too, and why isn't that client getting there? Is it a transportation issue? There's a lot that goes into it.
Well, as a nutritionist, I kind of come in secondary. The social worker and nurse get referrals, and they're the ones that do the initial visit and assessment of all their needs. And if it looks like there's a feeding and nutrition or breastfeeding issue, I get called in to help with that. So I may see clients just once or twice. Sometimes I'll see people more than even they will if the feeding is the most important issue that's going on. But yeah, we're assessing health, we're referring to other people, we're managing the case log, charting, and all those things are happening pretty much all day long.
Let me just go to the next slide. Okay, so what we have done, what I showed you is just a very short clip, half the clip really, because the other clip is showing them how they work together in a case in the community. But what I wanted to show you is how different roles work together in the community to actually help families the best way they can. And each of their role is very clear. And like the other speakers, the eminent speakers, Prof. told you, in interprofessional collaboration, the role clarity should be there, should not be any ambiguity, so that everybody knows what they are supposed to do and what their strength to contribute to the improvement of the service. So basically, I have actually covered with you what exactly is IPC, why we want to talk about IPC, the 3 different types of interprofessional collaboration or IPC. What are examples of IPC in healthcare, where 3 different people actually provide services to the same family, but looking at different family needs. So let's look at the vulnerable groups during COVID-19. But before we look at vulnerable groups, let's look at what is COVID-19. I think all of us, again and again, we heard about SARS-CoV-2, was known as COVID-19, was discovered in December 2019. Just to share with you, in Malaysia, because we are already very near to each other, our first case was actually diagnosed quite early, sort of in 25th January 2020. That's about less than maybe a month from the Wuhan episodes. And that is actually from the 3 Chinese nationals who went to Singapore and come across to Malaysia as tourists. So it's there where it started in Malaysia in January 2020. So definitely all of us know that the impact of COVID-19, not only looking at the healthcare needs, but also from the point of view, the economy, education, the social community, and of course, other sectors like the tourism, the hospitality. Now, why I brought this in is because all this, unfortunately, will influence the family dynamics, because if they have no employment, it affects poverty of family. And there's a poverty of family, the children suffer. And that is where they are very vulnerable because they do not have any control. And that can lead to a lot of social problems like child marriage, child abuse, child prostitution even. And in terms of education, as you know, if you have poverty, there's no way you can buy for each of your 4 children 1 laptop to do online learning. So in that sense, there is no accessibility for these people. So there is a lot of the what we call the domino effect from COVID-19 indirectly affecting our vulnerable groups. And who are these vulnerable groups? So vulnerable groups are not only the children, those who are old, who cannot actually, be accessible, actually able to do things on themselves, those suffering from chronic diseases with weak immune system that needs healthcare support, and of course the pregnant women. So all these, they may make them have not accessibility to the support that all of us need during this COVID-19 pandemic. Now in Malaysia itself, 64% of the COVID-19 deaths are actually hitting the elderly people, and they are actually suffering. And that's where we have to actually refocus our lens to different types of people in this pandemic, COVID-19. What about young children? Now, this actually looks, oh my God, out of 82,000, we have nearly 20,000 COVID cases. All right. So the cases are there. But as you and I know, children, alhamdulillah, seems to have a better recovery system that when they get the COVID, they seems to be able to cope with it. So our death rate, the fatality rate, is actually 0.2% among the young ones. It's only hitting like up to 25% for the older one where the immune system is poor. So in this sense,
you have 5 minutes left.
Oh my God. Okay. Yeah. So in terms of that, you can see the statistic on how it goes. For the pregnant women also, that is what is happening, that we are seeing more cases. So the plan in Malaysia is that we have started the pregnant women to receive their first dose between certain weeks of gestation to protect them. And before the 3rd semester, we actually have to make sure they finish their 2 doses. This is actually to bring down the pregnant women fatality rate. So in terms of poverty, unfortunately, it's shocking to me, but 1 in 5 children in Malaysia are actually living in poverty. And this is according to the Organization Economy Development. We look at 37 developed countries and see where is their child poverty. And I must admit that we Malaysians have a lot to do. That our child poverty is one of our issues too that we need to tackle. Don't talk about COVID-19. And we all should be aware, children are made up of 28% of the world population. It's a large chunk of our future generation. So this is actually a very quick look at what Malaysian government are doing. As you can see, our lockdown started in March, and obviously we have different lockdown, and in between this lockdown, we give support. And these 2 slides will actually share with you some of the Bantuan Perhatian Nasional, which are giving financial support as a social protection response. All right, so this is in a poster form. What is it all about? and of course for the elderly to support them financially, and also looking into child poverty, looking at having a national child allowance so that basically it can actually meet the children's needs. Now, this is all. The last two is about our existing plan, our existing pamphlets, our existing informations that we cascade down to all our population, including the vulnerable groups like the pregnant women, the elderly. And our key principles is actually coordinate and collaborate. We want to leverage physical, social, and all the intangible assets to work together. Right? So that's where collaboration works in. I'm finishing the last few slides. No, so the role of nurses, all we know. We have our role before, during, and after. But what I would like to tell is that even before, during, and after, the multidisciplinary team providing collaborative care should run across all these phases. We have to work together in order to fulfill all the needs of our customers in terms of different needs that they are highlighting. And this is what we see in our workplace. I think this is quite standard, and we have it too in terms of how we work together. Everybody have a part to actually make sure the environment is safe. Right? So what do we do during COVID-19? We have to have a common goal. We have to have support. We have to have the same value and teamwork. Actually, collaboration and teamwork goes hand in hand. Right? Now, I think this, I won't play this, but this is actually a 6 minutes a cartoon sort of video showing how different groups comes together. But don't worry, I'm not playing it. All right? Yeah, don't worry about that. So in conclusion, we have to realize that COVID-19 is here. It is still going. It's still continuing. We don't know what is happening, but we have to learn to live with it. And to learn to live with it, we need to do it together. Because COVID-19 has a high potential to have implications, long-term effect, especially for our future generations, the children. Of course, the existing elderly and the other immune system pregnant women. So supporting government programs involve not only the nurses, but all the healthcare professional team. So collaboration is especially significant in order to overcome this COVID-19 threat. There's no way we can do it alone. So I just want to highlight to everyone, actually collaboration is the essence of life. We see it everywhere. So the wind, the bees, the flowers, they work together. That's where we got pollen. That's where we got flowers. So basically, it is all around us. It's nothing new. So we have to actually wear a different lens and be more passionate about it. So thank you very much. And terima kasih for this opportunity. I'm so excited to actually join you in this panelists and also to learn from the other panelists. So Assalamualaikum, and pass back to you, Dr. Gasnini.
Yeah, thank you. You are very welcome, Prof. Khatijah. A very interesting topics and presentation. We do hope that you can share the material and also all video at the end of this conference, so our audience and attendees can learn more outside this very timely this conference. All right. Before we proceed to the third speaker, I would like to remind all the attendees to ask or write a question through the chat box, or if you're willing to ask your question directly to our presenters, you can also raise your hand at the end of during the question and answer session at the end of the first session. Okay, without further ado, please welcome the third speaker, Edwin, Auditor CTP BSE MSc PhD, who will be talking on child protection law and policies during the COVID-19 pandemic. Hello, Mr. Edwin. Can you hear me?
All right. Hello, everyone.
Okay.
Can you hear me?
Yes, of course. Yeah. Nice to meet you, Pak
Excellent.
Edwin.
Great to see you, Dr. Gusnadi.
Okay. Okay. Now your turns for 20 minutes presentation.
Okay. Please allow me to share my PowerPoint. All right. Can you see my PowerPoint now?
Yes, excellent.
Okay. Give me a second. All right. All right. Welcome, everybody. I am so grateful to all the officials, the admin of Polytechnic Kesehatan Padang. Of course, special thanks to Dr. Yuleva Sid, and I want to say thank you to Sari Dewi of Universitas Nigeria also. Of all the people behind in organizing this event. Guests, ladies and gentlemen, good morning. Yeah, first off, I want to thank you for your gracious invitation to be one of the speakers at this conference. Yeah, I am really honored to see that you have thought of me as a worthy person to speak at this conference on policy and protection of children and vulnerable groups in COVID-19 pandemic. Okay, now I was asked to talk about child protection laws and policies during the COVID-19 pandemic, but I realized to change the title as it sounds legalistic. And yeah, for two reasons. Okay, first, I am not a lawyer. Okay, second, I wanna focus on the use of laws and policies in particular country, okay, in protecting and empowering children. All right, and finally, different countries have different laws. All right. Okay, now let me begin with this international human rights framework. Okay, that's what it said. Different laws in different laws in different countries. And why is that? Of course, it boils down to just two things: history and social dynamics. Having said that, however, there are some commonalities between the laws of different countries, and these are mainly coming from human rights. I think everybody would agree to that. Okay, now human rights are rights we have simply because we exist as human beings. They are not granted by any state. Okay, these universal rights are inherent to us all, regardless of nationality, sex, national or ethnic origin, color, religion, language, or any other status. Now, they range the most, again, what I want to say is that they range from the most fundamental, okay, the right to life, to those that make life worth living, such as the rights to food, education, work, health, and liberty. Now, the Universal Declaration of Human Rights, adopted by the UN General Assembly in 1948, was the first legal document to set out the fundamental human rights to be universally protected. Now, it continues to be the foundation of all international human rights law. Now it's 30 articles provide the principles and building blocks of current and future human rights conventions, treaties, and other legal instruments. Now, the instruments of the International Human Rights Framework are the Universal Declaration of Human Rights and the 9 core human rights treaties. So as what you can see on the screen, one of the core human rights treaties is in number 6. That's Convention on the Rights of the Child. Okay. Yeah. Now, understanding this framework is important to promoting, protecting, and realizing children's rights, because the Convention on the Rights of the Child and the rights and the duties contained in it are part of it. Okay. So what I am saying is that all the laws, okay, and most of the laws, if not all, okay, in different countries are basically anchored to our human rights, and that includes the rights of the children. Okay, so the key points for discussion for today, okay, will focus on, my presentation outlines key human rights risk to children related to the COVID-19 crisis, and steps that the government should take, or my recommendations, okay, to protect children's rights in the pandemic, okay, just to mitigate its devastating effects and benefit children after the crisis over. I am hoping that this presentation would help somehow to review the measures taken by by you, of course, in my country, Philippines, okay, just to manage the COVID-19 pandemic. And I would like, a kind of advice on how to mitigate the negative impact they may have on children generally, and of course, in vulnerable situations. All right, the main source of this, okay, basically from the Human Rights Watch. Human Rights Watch is an international non-governmental organization headquartered in New York City that conducts research and advocacy on human rights. Okay, so the first I'm going to talk about, education of the children, okay, during the COVID-19 pandemic, the domestic abuse happening, okay, the death of parents and guardians. Okay, it talks about poverty, child labor, child marriage, sexual exploitation, including online, children deprived of liberty, and of course, I'm going to talk about some issues involving healthcare. Okay, now let me begin. All right, in the first one, I'm going to talk about the education of the children, especially the out of school children and youth. Now, according to United Nations Educational, Scientific, and Cultural Organization, or UNESCO, more than 1.5 billion students in 188 countries were out of school, okay, due to the COVID-19, okay, representing over 91% of the world's student population. The crisis has exposed vast disparities in countries, emergency preparedness, internet access for children, and availability of learning materials. Now, for many children, the COVID-19 crisis will mean limited or no education, or falling further behind their peers. Children affected by school closures also miss the sense of stability and normalcy that schools provide. Schools closures may, in addition to that, school closures may disproportionately affect children who already experience barriers accessing education, or who are at higher risk of being excluded for a variety of reasons. Now, these include, of course, first, children with disabilities, Okay, students in far-flung areas or remote locations, all right, that includes asylum seekers and refugees, and those whose families have lost income as result of job cuts and precarious employment or are otherwise in a difficult situation. All right, now many children from poor communities depend on schools, right, for meals and key health services and information. Okay, that includes in the Philippines, right? Nearly, right, for example, nearly half of the world's school children, all right, that's okay, based on the data, um, around 300 plus million children have relied on their school for a daily meal. Okay, like for example, in India, in Brazil, in some countries in Africa. Okay, so children are greatly affected by that. All right, now UNESCO has recommended that countries would adopt a variety of high-tech, low-tech, and no-tech solutions to assure the continuity of learning. Although much focus has turned to online learning platforms, now many schools are not set up to use them or don't have the technology and equipment to run online teaching or online education. Now, nearly half of the world has no access to the internet, even in the United States. Or the data shows that okay, 1 in 5 school-age children don't have access to a computer or high-speed internet at home. Even in China, right? Yeah. Some students have reportedly hiked for hours in search of a cell, a signal, just to listen to online classes on mountaintops or even on the roof of their houses. And yeah, it happens even here in the Philippines, okay, in provinces, in far-flung places, okay, some of the students would climb up, okay, on top of their houses just to get a signal, okay, just to get internet. Now, without exception, education policies focus on online learning in the wake of the COVID-19, and yeah, it highlighted long-standing inequities. Children living in the most disconnected places in the world also, face the least dependable and slowest internet, right, at the least affordable prices. Now, if they are connected at all, okay. Now, the
Excuse me, Pak
rush.
Edwin, we still have 5 minutes left. Okay, sorry for interrupting. Yeah.
Okay. Yeah. It seems that I have prepared more than slides. Okay.
Yeah.
Now to address that issues, all right, these are some of the recommendations, okay, policies to be implemented. Okay, number one is prioritize efforts to continue education for all. Okay, second, consider providing target funding to teachers. In cases where schools and teachers have very limited resources, the government should consider providing targeted funding to teachers and school officials in under-resourced areas so that they can contact their students, okay, print materials for all and distribute learning materials in more remote areas. Okay, what else? Government should take all possible measures to provide, okay, the fastest and the broadest possible internet service for all children, just to ensure the right to education. Okay, now next is the government can adopt mitigation strategies, okay, just to address the impacts of school closures on children learning. For example, by working with teachers, school officials, and teachers associations, just to factor in plans to recover teaching or contact hours, okay, contact hours lost, adjusting school calendars, okay, and the like. And lastly, governments and schools should include data privacy clauses in any contracts they sign. Okay, data privacy law. Okay, policies is very important. Okay, before design with educational technology providers in order to protect the data collected on children during this time from misuse. Over the longer term, governments should institute data protection laws for children. Okay, now the second issue that I would like to talk about is about domestic abuse. Even when countries are not in crisis, children are at greatest risk of violence in their own home. Now, basically, based on the data, according to the United Nations Children's Fund, 3/4 of young children ages 2 to 4 experience either psychological aggression or physical punishment, or both, by their parents or caregivers. Now, as you can see on the screen, there's been a 31% increase in the number of counseling contacts for any reason. Now, they received in the first 6 months of in 2020, all right, as compared to the first 6 months, all right, among for child helplines or hotlines that provided data for both the trimesters of both years. So the data shows that the number of contacts increased by 35%, during the pandemic. So it means that a lot of children are asking for help, right? And why is that? Okay, the obvious reason is that there's been added family stresses related to the COVID-19 crisis, including jobs loss, isolation, excessive confinement, and anxieties over health and finances, right? So that heightens the risk of violence in home, including both violence between caregivers, and the likes. Okay, so the school closures due to the virus may increase the number of cases of child abuse that go unreported. Okay, now let me discuss quickly. So recommendations, all right, or policy making. Governments should seek to expand services for at-risk households, including home visitation services by professional nurses and social workers, okay, to families where children are at elevated risk of violence. Hygiene and physical distancing, should be observed, of course. Now, second is that governments should expand public education and awareness campaigns on domestic violence and child abuse, okay, including prevention, ways to identify warning signs of potential violence at home, how to access services, and how a neighbor or friend can assist someone experiencing abuse. And lastly, governments should publicize hotlines and other services available to survivors of violence, including those living in areas under movement restrictions, okay, under quarantine, or those infected with COVID-19. Okay, next issue is that it involves the death of parents or the loss of parents or guardians. All right, now indicating that the COVID-19 was underlying cause, okay, in 94% death certificates. Okay, I'm using the data from the Public Health England. Okay, as the death toll continues to rise, of course, increasing numbers of children will be left without one or both parents or other caregivers. So the scale of the pandemic will certainly orphan a large number of children. Okay, of course, the consequence of that. Okay, so what are the possible policies? Okay, of course, first, the governments should implement family tracing systems to identify extended family members who might care for children who have lost their parents or guardians to COVID-19. Okay, second, governments should strengthen and support a network of trained foster carers, foster families to provide, alternative care for separated or unaccompanied children, including network of emergency carers. And lastly, ensure an adequate number of, social workers okay, to identify the specific needs of orphaned, okay, and unaccompanied children, okay, of course, providing assistance.
Excuse me, Dr. Adin. Excuse
Yes.
me. Okay. I think the rest of the slide is very interesting, but because we have a very limited time for these sessions, would you like to come back to the slide if we still have time at the end of the session? If I think that we don't have many questions from the chat box, so still, if impossible, we still have you can give a close remark at the end. Okay, it's okay for you to stop your presentation now.
All right. Can I share the last slide?
Okay. Yeah.
Okay.
It's okay. Yeah.
All right. Okay. Yeah. The COVID-19 pandemic has highlighted grave weaknesses in many countries' protections for children, okay, including inadequate healthcare, social protection systems, etc. Now, the United Nations Convention on the Rights of the Child is an important agreement by countries who have promised to protect children's rights. The convention explains who children are, or all the rights and the responsibilities of governments. A right respecting response to the COVID-19 crisis can not only mitigate the worst harms of the pandemic, but also benefit children over the long term. Okay, so the convention is informed by 4 core principles: the non-discrimination, the best interest of the child, the right to life, survival and development, and respect for the views of the child. Okay, before I end my talk, let me share this. The true character of a society is revealed in how it treats its children. Okay, thank you.
Okay, thank you, Pak Edwin. Very nice quote at the end. Okay, ladies and gentlemen, now we proceed to the question and answer question. We have had 3 speakers with the very outstanding presentation, and I think you all have recap with all the materials. Pak Adang talking about the community resilience, especially for the vulnerable group health services. And then Prof. Khatijah highlight about the importance of interprofessional collaborations in delivering health services, especially for children and vulnerable group during the pandemic. And the last, Mr. Edwin also highlight the effect of pandemic to the children education. So let me check for the question in the chat box first. Okay, the first questions come from Pak Muhsin. Yeah, Pak Muhsin asked to Pak Adang, to Mr. Adang, about the Pak Muhsin deliver the question in bahasa. Okay, I just read the question from Pak Muhsin. Pak Adang menarik terkait adanya siaga, tapi yang menjadi permasalahan adalah tidak adanya motor penggerak. Siapa yang seharusnya menjadi motor penggeraknya supaya kegiatan berkesinambungan? Okay, Pak Adang, probably you can provide the answer for all of us on the Muhsin's questions. Silakan Pak Adang.
Okay, thank you, Pak Gus. This is a very important question and actually related to the egocentric of the professions. Even further, I can state it that sometimes the profession manage for their own interest, not to the people interest. Actually, the question is related to who will be the motors of the engine to mobilize the people for Siaga COVID. Here, maybe he wants to mention about the Desa Siaga, tuberculosis and COVID-19. We do have program initiated by Balai Besar Kesehatan Paru masyarakat Bandung in many kabupaten. One of them in Garut Kabupaten, and they are moving very quickly to develop the Desa Siaga. And at the moment, I, with my team, develop a new program. We call it Innovative Antenatal Care, exploiting the concept of interprofessional collaboration, synergizing the midwives and the dentists and perawat gigi, dental nursing, to protect the pregnancies. This is very interesting initiative, actually. I would like to propose to Pak Muhsin and all in this podcast. If you want to listen very detailed about our experimentation in Kalimantan Barat, let's move to a special session in your campus. This is my answers about related to the egocentrics of the professions. Actually, we can move very quickly for interprofessional collaborations because we are saying to them that if you work together, this is very important to move on your marwah, what we call it marwah, your name, your profession, actualizations because of the interprofessional collaborations. So I'm waiting for your invitations. Thank you very much.
Thank you, Pak Adam, for the clear answers. Yeah, and then for the next questions is still come from Pak Muhsin for Prof. Hatijah. Pak Muhsin said that in the few last year in Health Ministry Polytechnic, we have tried to implement the interprofessional education and collaborative practice in our curriculum, especially for the students who those at the end of their study time. But the problem is we have difficulties to accommodate all the professional in one curriculum. For your interest in Health Ministry Polytechnic, we have 6 departments, consists of environmental health and then nursing, midwifery, nutrition, and dental health, and the last is health promotions. So we have to accommodate the department in our institution to give the experience to the student to have interprofessional collaboration experience in the field. So we need your advice how to establish the curriculum so we can make it better in next year. Prof. Hatijah, yeah.
Thank you so much. A very interesting questions, and I thank you for the question raised. To be very honest, in Malaysia, we are still working on it. Definitely, WHO have already, there's a framework saying that to actually make IPC work, collaboration work, it should go backwards, go stand, to look at how we actually train our professionals. Unfortunately, traditionally, we've trained them in silo. Like nursing school will do the nursing program, and physiotherapists will do their own. So now what we did in Malaysia, and definitely there is a number of private university and even University Malaya, what we did was that in the first year, we identified the core subjects. I think that we have to start in year 1 rather than at the end of the year. When after the 3 or 4 years, they already set their mind. This is my role. This is my territory. This is what I'm good at. So suddenly you want to work together. They say, this is mine. This is yours. So we decided to start in year 1. And what we did was that all the program heads sit together and identify the common foundation program. So in Faculty of Medicine, we do have medical students like you guys, and nursing, allied health science, radiographer, physiotherapist. So in the first year, like anatomy and physiology, the basic medical sciences, it runs across because we need to know what is normal, then we go to know what's abnormal. So what we did is that we actually tried to sit different program, same time, same date, same subject, but all of them are undergraduate. So basically the assessment also is the same. That is for credibility. We only have problem when we have diploma and degree, then the different levels come in. So what we did was that all undergraduate will have a call. So they sit all together, same levels, same session, same teaching. And when they do assignment, we encourage role play. We encourage assignment where there is group work. And in each group, it must be multidisciplinary. So we start them from year 1. Now, I must say that we're still working on it because obviously there's a lot of resistance. And definitely we do find that when they graduate, at the end, we ask them for their feedback. A lot of them sincerely says that they didn't realize that a nurse do so much. They thought the nurse just follow the doctors. But because we studied with them, we discuss with them, they then appreciate and value each professional roles and their responsibilities. This is something we thought it is still in infancy. I won't say that it is very successful. There's always resistance, but it actually has started people thinking and also started acceptance. I think for collaboration, each of us in the team have to acknowledge that there's different people have different strengths and have to actually work together with that. So that's what we did in year 1. And you run across year 2, year 3, year 4. And in clinical supervision also, when we do grand ward round, when we do clinical teaching, we try to encourage multidisciplinary clinical bedside teaching so that we hope to brainwash them basically to make them change. But that is definitely what we are doing. I'm not sure it helps, but yes, it got lots of up and down. And it is a mess in a way to make everybody kan sama masa, sama roster kan, nanti ada komitmen yang lain. But I think if you're willing to be flexible with the timing and the rostering, then it could be done. It's not impossible, I would say. So I hope that helps the person who asked how Malaysia do it, but this is what we did actually. And we do a lot of role play and stimulation basically. Thank you.
Okay. Thank you, Prof. Hatijah. So actually we are working on that issue at Health Ministry Polytechnic. And I do hope in the future we can still discuss about this IEPC and to make it a better implementation in the future. Okay, from the audience, I see there is a participant who raised hand, Pak Suhaimi. Would you like to directly deliver your question? Please address your question to our speakers. Okay, please unmute Pak Suhaimi. You are still unmute. Are you still mute? Okay.
Okay. Thank you, Mr. Gusnedi Diwarman, as a moderator of this session. And then I would like to ask to Mrs. Professor Dr. Khatijah Abdullah. Assalamualaikum, Prof.
Waalaikumsalam.
Maybe it is still morning there. I would like to say good morning to you.
Yes, it's selamat pagi because basically
Selamat pagi. Okay, good morning.
Yeah, 1 jam.
1 hour. Yeah.
Yes.
It is 1 hour different from Indonesia.
Yes,
from
yes.
Padang.
It was good.
Okay. Nice to meet you, Prof. Khatijah.
Prof. Suhaimi. Yes, thank you so much.
Okay.
Is there anything we can discuss? Yeah.
Okay. I think it is an interesting speech about the role of interprofessional collaboration. That we know maybe in Indonesia or in Malaysia, we have previous the role of interprofessional collaboration, even in hospital or in public health center. But nowadays, because of COVID-19 pandemic, we have new the role of interprofessional collaboration. My question is that is that permanent role? Is there permanent role of interprofessional problem in Malaysia, and then how is going on now? Maybe can you explain, Prof. Khatijah? Thank you.
Thank you very much, Prof. Suhaimi. If I understand your questions, you are trying to ask me what is happening in Malaysia for the role of interprofessional collaboration among healthcare during COVID-19, right?
Okay, that is right.
Right. Yeah. Okay. Thank you so much. It's very important that we do not actually continue to work in isolation. As it is COVID-19 memang dah dibuatkan kita isolate. We cannot have meetings and we cannot actually discuss a lot of things face to face. But as you all know that now the connectivity is the IT play a very important role. So actually all the team actually have set days and time where they actually have what we call the virtual meeting with the team to discuss. What we did was that we have case presentation, and then we discuss what is the issue and what each one of us actually can do to help this patient. So for example, that there was a case of an elderly is stuck in nursing home with bed sores, but also because of COVID-19, they could not be admitted. So then the team will actually identify who is going to be involved, the social worker, the nurse, of course, the wound care people, and also definitely in terms of whether the family should be involved also. So we use a lot of technology, unfortunately, but I think all of us know that actually have opened our eyes to a lot of possibilities. So we do WhatsApp group messaging and also do virtual meetings to discuss our solutions and our opinions on how best we can actually handle this patient. And in terms of action, like you and I know, so how are we going to do the dressing and all those things? We have to practice the 3 Ws and 3 Cs, that in the sense that if we need to go, then we will still have to go to do the face-to-face dressing per se, if the patient cannot be admitted. I'm not sure that's what you're trying to ask me, how it works in COVID pandemic. So, but definitely we use a lot of technologies. So we form a lot of platforms, Zoom and Google Meet, to actually have interactions, and we set time. So every Monday morning is our grand walk round virtually, and every Wednesday afternoon, we would not see patient, we will come back and discuss any of the issue we face during that week that we need, refer or we need help from the other team. So we do those things virtually. Prof. Suhaimi, does that answer your questions?
Yeah, thank you very much, Prof. Khatijah. Maybe I can get your point. And then thank you, Mr. Gusnedi. Bye-bye. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam, Pak Suhaimi. Thank you very much for the question, also the answer from Prof. Khatijah. And I would like to back to the chat box. There are 2 questions for Mr. Edwin. I think the 2 questions is similar. I would like to read the last question from Lita, Lita Angelina Saputri. Lita said that as we can know that pandemic affect everyone, including children, it increased poverty, school dropout, the way of parenting, and the way we communicate. Child abuse is like an iceberg phenomenon, and it greater today. The question is, what is practical strategy that we can do as a citizen, as a neighbor, in preventing and protecting children from the abuse? So the same question is from Pak Muksin previously. So Pak Edwin, would you like to give the answer?
All right. Good morning to everyone. That's a great question. Okay. Now, basically, I would say that sexual abuse, for example, can happen to. Can you hear me? By the way.
Yeah. Okay. Yeah.
Okay. So as what I've said, sexual abuse can happen to children of any race, socioeconomic group, any religion or culture. I would say that there is no foolproof way to protect children from sexual abuse. But of course, there are steps we can take to reduce this risk. We have to keep in mind if something happens to your child or any child for that matter, remember that the perpetrator is to blame, not anybody else. Okay, especially not the child. So some practical tips. Okay. Um, yeah, being actively involved in a child's life can make warning signs of child sexual abuse, for instance. Okay, more obvious and help the child feel more comfortable. Okay, coming to you if something is not right. Now, if you see or hear something that causes concern, you can take action. Okay. Any action to protect your child. Okay. So number one tip is, practical tip is you have to show interest in their day-to-day lives. You ask them what they did during the day and who they did with it. Okay. You can sit with them at lunchtime or any break time. Okay, you ask them what games did they play after school. You ask the children or the child if they enjoy themselves, himself or herself. Okay. Second, get to know the people in your child's life. Know who your child is spending time with, including other children and adults. So you ask your child about the kids they go to school with, the parents of their friends, and other people they may encounter, such as the teammates, trainers like that. You talk about these people openly and ask questions. Okay, so that your child can feel comfortable doing the same. All right. Third, you choose caregivers carefully. Okay, guardians, you choose very carefully. Whether it's a babysitter, helper who can do the work after school, we have to be very careful. Okay, be diligent about choosing caregivers for the child. Right. Next is can talk about the media. Okay, incidents of sexual violence are frequently covered by the news and portrayed in television shows. Okay, you can ask the child some questions about the coverage to start a conversation like, okay, have you ever heard of this happening before? Or what would you do if you were in that situation? Okay, of course, children are aware of latest news involving that kind of issue, right? Now, based on their responses, that could be a very good signal to your child that these are important issues that they can talk about with you, right? All right. And next is you can know the warning signs. Okay, you have to be as parents or caregivers or brothers, sisters like that. We can become familiar with the warning signs of child sexual abuse, for instance, and notice any changes with the child, the changes when it comes to behavior, the way they act, no matter how small. Okay, whether it's happening, okay, you should know you have each one of us has the potential to make a big difference in the child's life. Of course, okay, final thing, we have to encourage children to speak up. Okay, that's a very important thing. Okay, we have to teach them their boundaries. Okay, talk about their bodies, okay? And of course, be available. Set time aside to spend with your child, okay? The children where they have undivided attention, okay? I hope that, I hope that helps.
Okay.
Thank
Thank you very much for very complete answer, Pak Edwin. Bapak dan Ibu sekalian, tadi Pak Edwin menjelaskan bahwa untuk mencegah anak supaya terhindar dari perbuatan yang abuse dan segala macamnya, kita harus pastikan bahwa anak-anak memang berada pada lingkungan yang kondusif. Kita harus memperhatikan dengan siapa dia tinggal, siapa yang mengasuh, kemudian educate mereka. Kita harus memberikan pendidikan kepada anak sedini mungkin tentang bahaya-bahaya yang mungkin mereka alami selama mereka berinteraksi dengan lingkungannya. Okay, thank you Pak Edwin for the answer. Ladies and
You're
gentlemen.
welcome, Dr. Gasnadi.
Yeah. Ladies and gentlemen, I think this is a very interesting topics. We can see that all the speakers complement each other, and what we are talking today, I think, very fruitful. And to end this session, I would like to re-invite each speakers to give 1 or 2 minutes closing remarks as take-home messages for our attendees. We start from Pak Adang. Would you like to give the closing remarks for this session this morning, Pak Adang?
Yes, thank you. The last question for me is still related to interprofessional collaboration.
Yeah.
I do have 2 points for that. Empirically, actually, solo practices is disappearing. Everybody working in the hospital setting, in a clinic setting, then we are moving to interprofessional collaboration.
Okay.
And the second opinion is related to our experimentation in West Kalimantan, trying to help Puskesmas Nakes to have interprofessional collaboration between midwives, bidan, the dentist, and also the dental nursing. Thank you, Pak Agus, and this is a very nice meeting.
Thank you, Pak Adang. And then Prof. Khatijah, would you like to give a closing remark for us?
Thank you so much, Prof. Raslindy. So, Assalamualaikum. I really want to congratulate the organizing committee, first of all. Well done. Very interesting and very pertinent issue. It is also my interest that definitely we can no longer work in silo. We have to work together. And at the end of the day, our objective is actually to improve our patient care, to improve population health, because they are a future generation, especially the children. I think teamwork is the key to any collaboration, and also learning from each other is the best way to actually get to know each other and use each other to improve service. So thank you so much. Assalamualaikum.
Thank you. You are welcome, Prof. Khatijah. Excellent. And then last but not least, Pak Edwin, your closing mark, please.
All right. First up, I wish to commend everybody, especially the Polytechnic Kesehatan Padang, for hosting such this impressive conference. Although we don't meet in person, the level of engagement in this conference is remarkably high. So meeting virtually has allowed an expansion of the space for dialogue with you. Now I see the potential for further engagement to grow steadily and become more diverse every year. Okay, working as a resource person, from the Philippines, of course, Indonesia. Of course, I know the importance of the topic, especially the issues that I have shared. I hope that everybody has learned something. As what I've said, as what I have shared. My warmest thanks to all of you. Thank you.
Okay. You are welcome, Pak Edwin. Okay, ladies and gentlemen, once again, we all thank you for our all speakers, Pak Adang, Prof. Khatijah, and then Pak Edwin from Philippines. And also thank you for all the attendance, for your nice attention. And as a moderator for this morning session, I would like to say goodbye for all. I think we come to the end, and see you next time. Yeah.
Thank you.
And back to the Master Ceremony.
Thank you, and allow
Thank
me
you,
to
everyone.
leave this important meeting.
Okay, thank
Assalamualaikum
you.
warahmatullahi wabarakatuh.
Ya, Assalamualaikum warahmatullahi wabarakatuh, Pak. Ya. Ya.
Okay, thank you, Pak Gusnedi, and also all our speakers for a great first panel. And ladies and gentlemen, next we will break for a while, and let's see the video from one of our students in Poltekkes Kemenkes Padang.
Hari ini kasus COVID-19 nasional masih bertambah dan mengandalkan dari Kementerian Kesehatan untuk hari ini sebanyak ada 4.000.
Assalamualaikum warahmatullahi wabarakatuh. There are more than 3 million cases of positive COVID-19 in Indonesia right now. The prevalence is increasing day by day. It is estimated that the number of deaths from COVID-19 increases continuously.
Gejala penyakit mirip dengan gejala influenza. Ya, itu ada periode-periode nanti berbagai gejala akan bermunculan ya, bertahap. Gejala awal adalah sakit tenggorokan, ya, kira-kira 1 sampai hari ketiga, ya, kemudian mulai hari keempat nanti baru mulai ada keluhan batuk, ya, badannya agak mulai sedikit hangat, ya. Kemudian bisa juga nanti disertai dengan keluhan diare, ya, kemudian sakit kepala, baru nanti tiap harinya akan berlanjut.
To prevent COVID-19, we have to know the causes and also think how to overcome it. That's why, as a nutritionist student, I try to find alternative, innovative, and solution to prevent COVID-19 disease. COVID-19 infection can cause mild, moderate, or severe symptoms. The main clinical symptoms that appear are fever above 38 Celsius degrees, anosmia, cough, and diarrhea. COVID-19 can be prevented by implementing health protocol and maintain body immunity. This innovation is for increasing the body's immunity. Many kinds of food to increase the body's immunity, but now I want to highlight a local, cheap, and easy to get food. It is from Dadia, or traditional yogurt from Minangkabau. Misi, Pak.
Iya, Kak.
Ikut Dadia, Pak.
Iya, Kak.
Dadia tuh asal dari mana, Pak?
Asal Dadia aku dari Bukit Tinggi, Kak.
Dari Bukit Tinggi ya, Pak. Berarti kok khas makanan Sumatera Barat,
Iya,
Pak?
khas makanan Dadia aku kan dari susu kerbau yang difermentasi, Kak. Jadi fermentasinya dalam bambu kok, Kak.
Berarti alami kok, Pak?
Alami. Ya, nggak pakai pengawet kok, Kak. Ya, kalau pakai pengawetnya nggak jadi, Kak.
Oh, nggak jadi.
Nggak bekunya. Gitu.
Iya. Iko berapa harganya, Pak?
Kalau yang kadang kok 30, Kak. Kalau yang ketek 25 itu yang di bawah.
Oh, iya, iya. Boleh lah, Pak. Balik cek, Pak.
Jadi yang kadang yang ketek deh, Kak.
Yang kurang kadang ya,
Yang
Pak?
kadang. Jadi.
Iya.
Saya, Kak. Di buku ya, Kak.
Iya, Pak.
Tuh, Kak.
30 ya, Pak?
Iya. Makasih ya, Kak.
Ya, sama-sama, Pak.
Ya.
This is a traditional yogurt from West Sumatra. We call it Dadia. And it is a fermentation of buffalo's milk. And we can find it easily in West Sumatra. Many researchers found that Dadia can increase the body's immunity. In the processing, I will modify with soy milk and Dutch eggplant. Before we come to the making process of functional drink, let me introduce myself first. My name is Mardatila, second year student of Nutrition Department of Poltekkes Kemenkes Padang. It's a happiness for me as mahasiswa berprestasi 2021 and become the representative of my campus. And this is my beloved campus, Poltekkes Kemenkes Padang. I'm part of Foreign Language Students Organization or UKM Bahasa Asing. I'm also part of storytelling team and followed a national competition in this year. Our team got the ninth Grand Champion in this competition. My other achievement is become Duta Genre Kota Padang 2019. Be the first winner of Genre Flash Mob in Genre West Sumatra 2020. I have ever involved in a short movie competition of West Sumatra as a scriptwriter and got the third winner in this competition. Be the speaker for seminar about nutrition. Besides that, I'm a content creator and businesswoman. I own a hijab brand named Shira Scarf since 2019. I have many customers, not only from Indonesia, but also from abroad, like Taiwan, etc. And this is my profile at Singgalang Daily Newspaper. We need 20 gram dadia, 100 ml soy milk, 15 gram Dutch eggplant extract, 10 gram brown sugar. How to make it? First, cut the Dutch eggplant. Take the fruit filling. Second, blend it without water. Third, filter the Dutch eggplant. Next, melt palm sugar with water for 2 minutes. The temperature is about 80 degrees Celsius. And then, blend their dadia and soy milk with water. After all the ingredients have been processed, the drink is ready to be served. The name is Prodimon. It is a delicious, healthy, and functional drink. There are many benefits by consuming Prodimon as functional drink. It is good to maintain and optimize the nutritional status of self-isolation COVID-19 patients. It is also good to improve the digestive system such as nausea, bloating, and diarrhea, increase the appetite, accelerate the recovery of anosmia, increase the body freshness. And now, the product has been packed and labeled like this. It's ready to consume for everyone to increase the body's immunity in pandemic COVID-19. Lastly, I want to emphasize that COVID-19 is a serious disease. It can increase the number of deaths in Indonesia. By consuming Prodimon from dadia, soy milk, and Dutch eggplant, not only good for the alternative health drink, but also as a delicious medicine to increase the body's immunity. As a nutritionist, I have an important role and also a big responsibility for the health of people around me and in Indonesia, because a healthy nation is a strong nation. Wassalamualaikum warahmatullahi wabarakatuh.
Well, ladies and gentlemen, that's the video one of our students in Health Polytechnic of Padang. And as our rundown of the day, we will come to the second panel, and it will be led by our moderator, Mr. Suhaimi. Okay, I will share the curriculum vitae. So here it is. Mr. Suhaimi, Nurse Suhaimi MK, lecturer in Nursing Department Health Polytechnic of Padang. And the background we can see from the curriculum vitae. Okay. All right, so we will invite Mr. Suhaimi. Hello, sir. Wait a minute. To IT, please help.
Hello, good morning.
Okay, good morning, Mr. Suhaimi. Nice to meet you.
Nice to meet you too.
Okay. All right, for the second panel, okay, you can next, you can guide, and the time is yours. Thank you.
Oke, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you for moderator, Mrs. Revi Nilamsari. She's a good moderator. I like it. I like her. Okay. First of all, I would like to say Alhamdulillahirabbil alamin. Assalatu wassalamu ala asrafil anbiya wal mursalin wa ala alihi washabihi ajmain. Allahumma salli ala Sayyidina Muhammad wa ala alihi Sayyidina Muhammad. Moderator and our distinguished speaker, Dr. Shularat Harhad, PhD RN, and then Mrs. Gita Nirmalasari, SST, MCAP, PhD, and then the last one is Mr. Muksin Rifiwanto, SKM, MSc. Maybe first I would like to greet all audience. Assalamualaikum warahmatullahi wabarakatuh. And then good morning, everybody, audience, ladies and gentlemen, on three of our speakers. Maybe halo? Masih itu deh. Masih. Hello, good morning, Dr. Shularat.
Yes, good morning.
Is it still morning there? What time is it now in Bangkok?
In Bangkok, it's 11 o'clock in the morning.
11. Oh, okay. It is still morning. Okay, good morning. One must. Okay, nice to meet you, Dr. Shularat.
Nice to meet you. Yeah.
Okay. Is it right? I pronounce your name?
It's very, very excellent.
Shularat Harhad.
Yes, it's very excellent.
Okay, thank you. Next, I would like to call, Mrs. Gita Nirmalasari. How are you, Mrs. Gita Nirmalasari?
Yeah, Bapak. Alhamdulillah, I'm fine.
Hello. Where are you now? Are you in
Osaka,
Japan?
Bapak? Yes, in Japan.
In Osaka, Japan. Okay. What time is it now?
Now around 1 p.m.
1 p.m. Okay, I would like to say good afternoon, Miss.
Thank you so much.
Gita.
Good afternoon.
Okay, nice to meet you.
Nice to meet you too.
Okay, the last one, Mr. Muksin Rifiwanto. How are you? Mr. Muksin?
Good morning.
Okay. Good morning, Mr. Muksin. How are you?
I'm near you.
Okay, thank you very much. Okay, welcome to the third international conference on policy on protection on children and vulnerable group in COVID-19 pandemic. Today is Saturday, 11 December 2021. Okay, I'm Suhaimi as a moderator for second panel session. And then we have three speakers. Maybe I would like to talk about the role of our second panel session. Number one, introduction, and then second one, I would like to read CV of speaker, and then the third discussion, and then the last is a closing statement for each speaker. Okay, let me to say your curriculum vitae. Number one, maybe bisa siapa minta menampilkan? Ah, ya, okay. Can Mr. Nico please appear the curriculum vitae for Dr. Chularat Hauhans? Mr. Nico. Okay. Maybe while waiting for the appearance, I'm going to read the curriculum vitae of Dr. Chularat Hauhan, PhD, RN. Boroma Rajoneni College of Nursing, Surin. Yeah. And then educational background, BSN, Nursing, Barom Rajonani College of Nursing, Surin, Thailand, 1992. And Magister of Science, Human Reproduction and Population Planning, Mahidol University, Bangkok, Thailand, 1996. And the last, PhD, School of Nursing, the University of Texas at Austin, graduation, 2008. Okay, next, I would like to say to talk about the job and experience. Dr. Chularat Hauhan, she is nurse instructor, obstetric nursing department, Borob Brajonani College of Nursing, Surin, Thailand, 1992 till present now. And then co-advisor of PhD student at Mardalalen University, Sweden, 2013 till now. And editor of journal Baroma Rajonani College of Nursing, Surin, 2019 till now. And the certificate of advisor, Mälardalen University, Sweden at 2013, since 2005. And the last, the member of Sigma Theta Tau International, Epsilon Theta Capture, USA, a member of Southern Nursing Research Society, USA. And then there is a curriculum vitae of Dr. Chularat Hauhan. And then the second, I would like to tell about the curriculum vitae of Gita Nirmalasari, SSD, MCAP, PhD, Osaka University, Japan. The educational background, midwifery diploma, Cipto Mangunkusumo Health Department, Jakarta, 2001. And then Bachelor of Midwifery, Medical Faculty of University of Pajajaran, Bandung, 2003. And Master of Midwifery, Medical Faculty of University of Pajajaran, Bandung, 2009. And PhD in Medical Science, Graduate School of Medicine, Osaka University, Japan, 2021. Okay, next, job and experience. She's a teaching fellow, assistant professor for medical student, bachelor degree medical student, medical English course, medical education, Center Graduate School of Medicine, Osaka University, from May 2017 to March 2021. Representative from Department of Public Health, Graduate School of Medicine, Osaka University, for Inter-University Exchange Project International Course in Osaka University, Japan, November 2020. And the last one, she is winner of research presentation for international speaker in annual meeting of Japanese Public Health Society on October 2019 in Kochi City, Japan. It is the curriculum vitae of Gita Nirmalasari. And then the last one, our speaker is Mr. Muksin Reviwanto, SKM MSc. She is an associate professor, Department of Environmental Health, Health Ministry, Indonesia, Polytechnic of Padang. Education, Diploma in Environmental Health Academy of Padang, 1992. Then Bachelor in Public Health, University of North Sumatra in 1999. And Magister of Environmental Science, Andalas University in 2002. Job and experience, lecturer of Department of Environmental Health, Polytechnic of Padang, of Center of Excellence, Health Ministry, Health Polytechnic of Padang from 2018 till now. And she is active in the disaster management, climate change, and public health. Maybe those are the curriculum vitae of our speaker. And then next, I would like to call one by one our speaker to give speech. Number one, I would like to call Dr. Chularat Auhan, PhD, RN. Hello, Dr. Chularat?
Yes.
Okay. Are
yes,
you ready?
I'm ready.
Okay.
Yes, I'm ready.
Your topic is about handling of child exploitation during COVID-19 pandemic. Maybe you have time 20 minutes to give your speech. After that, we go to next speaker. Okay, time is yours.
Okay. First of all, I would like to thank for the moderator for introduce my CV, and you're very experienced in call my name. That's correct one, Chularat Auhan. And thank you for the Center of Excellence of Science and Technology Health, Ministry Polytechnic of Padang, and health professional organizations to invite me to talk about child exploitation during COVID-19 pandemic in this very excellent conference. So when we, let's see, okay. Okay, you guys see my slides, right? Okay. Okay, so actually when we discuss about the child exploitation during COVID-19 pandemic, actually it's not like a standalone phenomenon. As someone mentioned in the chat box that this phenomenon is like an iceberg phenomenon. So actually we can see only maybe 20% of these informations. They have a lot of more information that we cannot access to that information. And so when we talk about the child exploitations, is will be linked to the abuse, neglect, and violence. And during the COVID-19 pandemic, hundreds of millions of children around the world will likely to face increasing threats to their safety and well-being, including mistreatment, gender-based violence, exploitation, social exclusion, and separate from caregivers because of the action they're taking to contain the spread of the COVID-19 pandemic. And as Mr. Edwin mentioned that it's more than 1,500 millions of children in 188 nations around the world that affect with the COVID-19 pandemic. So when I talking about the children's exploitation, I may not connect cannot explain only the exploitation. Maybe I have to link to the abuse and violence. So I will divide my discussion into 2 points. The first one is how the COVID-19 pandemic affects of the child's health status or children's life. And the second one is how do we handle, how to do with this phenomenon. So I'm thinking, I'm quite sure that maybe most of you have information about this cycle. When we in Thailand, when we discuss about the health status of people, we link into 3 factors. And as it's a cycle that I show here, you see that sometimes we cannot exactly tell that which one is the starter point of this cycle. Such as if we think that it start from the low education. So from the research finding, we see that because of the low education, they maybe get low income job. So that's linked to they have the low income salary, low income job. So it considered that they are poor families. And because of the poor families, they easily to get sick. And sometimes because of they get sick easily, so they can access to the education. So that's why they have the low educations. So this is a cycle that we cannot know which one is the beginning and which one is the end point of this cycle. So when we explain about the COVID-19 effect to this, I think, and from the research finding, so this is the worst case. The worst case is that it starts from that they get infected with the COVID-19 and get very ill, and some maybe they pass away. So because of their parents or their family members or their caregiver get ill because of the COVID-19, or sometimes they have like a pass away. So the worst situation is that they have no caregiver to taking care of their children, their parents or other family members. And they can have to close because they have to lock down. And because of the daycare closed and they cannot go to the school, most of the children stay with the elderly. And I think you can imagine that very little children that stay with the elderly, and the elderly cannot fully 100% take care of their children. So that's why children easy to get abused or exploitations or neglect or mistreatment. And because of this, they stay with the elderly or themselves because they are vulnerable group. They have very low health literacies. They don't know how to take care of themselves because of most of them have like very low education. And it's not 100% of children that access to the educations. Overall in Thailand, it's only 92 to 95% of children that access to the education. So it means that 5 or 6% they have no knowledge how to take care of them. And because of that don't have knowledge, they don't know how to take care of themselves. So it means that they're dependable to others. And because of the dependable, they don't have educations, they cannot get job, so they cannot support, especially right now, very expensive medicine healthcare. Although in Thailand, most of the people that access to the universal health coverage, it means that when they go to the hospital, they have not to pay. They get payment from the government. But most of the hospital that can take care of their health problems is located in the city. So, and then they cannot access to the healthcare. which have like a very high ability in taking care of their health status or health or the disease or sickness. So you see, this is a very worst case, and its direct effect to the health status of the children. And if, okay, maybe some families, the problem is start from because, okay, there's in the family, that in the society or in the community that they have the low education, especially for the families that they have very low income jobs. Most of these families, they not stay longer in one community or one factory to doing a job. They relocate every year to find another job that they can get more payment. So in this case, most of the children in this, their families, some have very low income. They cannot access to the job, to the high education. So because of the COVID-19, these families, we found that 23% no job because of the pandemic of the COVID-19. And from, sorry. See, okay. And we found that 9 million of the women have no job, and 5.57% they have to relocate. As I mentioned, that they have to looking for another job, and because of the COVID pandemic, so some business have to shut down. Some have like a bankrupt because of the COVID-19. So this is another worst case of because of the COVID-19 pandemic. And the problem is that we found that the increased number of the children that they have homeless, and this group have very high percentage of have the sexual exploitation. And other is about that some children cannot afford to the food or nutrition because of other before the COVID-19, they depend on the school lunch. But because of the COVID-19 pandemic, the school closed, so they cannot access to the school lunch. So because of this, their health status is getting worse. They have the poor health status. And because of their poor, they cannot access to the healthcare. And because they cannot access to the healthcare and healthcare providers, because we have the most job due to the COVID-19, due to the COVID vaccines that we have to increase to provide the vaccine to the people. So we found that most of these groups have the higher stress and anxiety. We found that more than 74% state that they stress and anxiety. About 10% they have the depressions. So this number is increased before, when we compare with the before COVID-19 pandemic. The percent of the children that don't have to get depression is higher. Yes, because of that, higher number of the children increasing that they have abuse. And because of the poor families, they no job, no money. We found that the increased number of the children that they said that they have family violence. So this is another worst case of that COVID-19 affect the children's life. And the last situation is some family, because of the poor, they are in the poor families. So they have no job, they have no money, and they cannot support. As I mentioned, that about 5 to 6% of the children that they never go to the school. They cannot read, they cannot write. And other because of the schools closed, they have to study online. But because of the poor families, you see that in some family, they have like 3 children or 4 children in that family, but they have only 1 television. So how can other to get access to the online class? Some families cannot buy another cell phone or mobile phone, cannot looking for another computers. So it means that they have to very strict to their timetable. They have to start at 1 to 9. The maybe the biggest children in that family go to the online class, and another. But how another, because of the parents have to go to looking for a job, or some families, the parent passed away because of the COVID-19, so they are homeless. And so from the findings, we found that 84.6% they face with the financial problem. And because of this, they said that they have the poor status, they easily to get sick. So 74.58% they have stress and anxiety due to the financial problem. Yes, they said that they have the depression. And for the high school students that they have to have online class, and they don't know, they're quite not sure that when the school is open. And because of their high school students, they are very worried about the education and university entrance. They just mentioned that, do I still have a chance to go to the university, or do I have to waiting for another years? And who knows when the ends of the COVID-19? So, and we cannot answer that questions. And we found that they get sick with other health problems. We have the surveys about the health status for children in Thailand. We run every year, and we found that the lower age of children in Thailand, they get higher blood pressure. They get more problem with the fat problem. They have like a higher BMI, so it means that they tend to have non-communicable disease at the early age.
Mrs. Dr. Chularat?
Yeah.
Maybe I just remind you that you still have 4 minutes more. Okay. Next.
Okay, thank you. And another is that this is linked to the sexual exploitation is in the LGBT IQ group. So they actually anyway they suffer from stigmatization and abuse. And now because of the COVID-19, they have incomes and job, so they're living in unsafe situation. And yes, it's the same with other group. They have low health literacy, don't know how to take care of themselves, which made that sickness getting worse. So this is a situation of the COVID-19 that affect with the children's abuse, exploitation, and violence. So, okay, this is just summary of that I mentioned before that. So actually, you know what? Because of the COVID, so we pay more attention about how to prevent the COVID-19 infection. So we do a lot of the health. For my research finding, we found that healthcare volunteer help us a lot, healthcare system a lot in prevent COVID-19. However, that is not enough to taking care of the children about child exploitation. So we have the policy that we say that leaving no one behind, protecting vulnerable populations and groups against violence, exploitation, and abuse. So we say that to ensure the safety and well-being of children during the COVID-19 pandemic, we say that children is a key actor for enhancing others' health literacy too. So we go into help children that they can be a key actor to enhance other health knowledge, health literacy, and then they can help together to taking care others at taking them their selves health and others health. So we need to work as a network. We have to do with the collaboration with 4 ministry of public health, Ministry of Education, Ministry of Internal Affairs, and Ministry of Social Development and Human Securities. We have the online courses for the children, so they can enhance their self-efficacy. They they try to decrease their stress and anxiety, decrease the depression, and they can have like a very strong health status. Yes, we have to work with the government and non-government. And more important for children that we have the peer group. So with this kind of activities, we have a lot of the guidelines for these 4 ministry. And we believe that we can find the safety and well-being of children during the COVID-19 pandemic and during the next normal after the end of the COVID-19. So thank you very much for this is the end of my presentation. Thank you.
Okay, thank you, Dr. Chularat. Nice to hear the speech. And we have, please stay up at your place waiting for the next speaker. Okay, next I would like to call the second speaker, Mrs. Gita Nirmalasari. Hello.
Yes. Okay, thank you very much, Pak Suhaimi.
Yes, okay, welcome.
Yeah,
Nice to meet you.
Nice to meet you too.
Okay. Okay, I would like to call you to give your speech.
Okay.
Maybe your time is only 20 minutes. We start from now. Okay, time is yours.
Okay, thank you very much, Bapak Suhaimi, for the time for me. Thank you very much for the Poltekkes Kemenkes Padang for the opportunity given me as one of the speaker in this international seminar. I will a little explain about this title, COVID-19 Prevention and Management Among Women and Vulnerable Group with HIV/AIDS. And this is the outline that we will discuss in the 20 minutes. The first one, maybe a little briefly, we will discuss about COVID-19 and women and vulnerable group with HIV/AIDS. And the last part, we will discuss about prevention and management among women and vulnerable group with HIV/AIDS. Okay, before we discuss about the COVID-19, so we know and we understand that this is the COVID-19 is kind of the coronavirus, and the coronavirus in this slide you can see coronavirus are a large family of the virus, and they can make some cause of illness in human and other cause illness in animal. But we don't need to explain more about this because all people already understand about this. And most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment sometimes. But however, some will become seriously ill, severe ill, and require medical attention. And in the most severe cases, people with the virus can develop like a difficulty breathing and may ultimately experience organ failure. Sorry, I have a little bit cough and maybe my voice not so clear. Okay, so we briefly remind again about the HIV. This is the HIV stand from the human immunodeficiency virus. And this virus is infective for the human being and can decrease and make weakness in the body ability and to fight of infection and illness. So it's need some treatment properly, but the body condition, if don't have like properly treatment, so it's become weaker and more susceptible to infection, other infection disease. And a bit about the HIV/AIDS again. So this is the infection lead to the weakened immune system. We already understand about this one, and now we will learn how to, is the HIV transmitted. We know this is from the unprotected sexual contact, of course. So we need to explain about this first, because we will go to the explain about the vulnerable people. And HIV transmitted come from the exposure of broken skin and transfusion with IV infected blood, injection with a contaminated object, and mother to child during pregnancy, birth, or breastfeeding. Okay, next we will discuss who is categorized as a vulnerable group related to the HIV/AIDS. We see on this slide, vulnerable population are a group of the people who are particularly vulnerable to HIV infection in certain situations or contexts, such as adolescents, orphan, street children, people with disabilities, and migrant and mobile worker, of course. And in addition here, the following condition, like gay men, who have sex with men, sex workers, transgender people, and people who inject drugs, and the prisoners, people with some kind of diseases like hemophilia, infant and children, women and people of color, key population group that are, particularly vulnerable to HIV, and frequently lack adequate access to the services. And this is the data. This is the data from the WHO. So I try to find this from the literature from the WHO. We can see here in 2020, the estimation of the people who are living with HIV, including children, it's quite high, around 37.7 million people. And around 16 of those people, they don't know that they have a virus, so it's become danger. And 2019, 65 of the new adult HIV infection globally were among key affected population and their partner, including the vulnerable population that we talked in the previous slide. And from this data, I found that young women are especially at risk, with around 5,000 new infections each week occurring among this group. And from this data, 25 of HIV infection we can find in the young population, especially girls and women inside the data. And if we look at the result of the statistic, we can conclude that the following group are very vulnerable to being infected with the HIV/AIDS. And still with the data, from this data we found 35% of women in the world who have experienced physical and sexual violence are known to be at risk of HIV infection in some areas. So 35% need to be careful. We need to addressing this problem. And this is the significant relationship between HIV infection in the last 12 months and sexual violence. So why this is the important things, women and children and girl, young women, it's become the vulnerable people for the HIV. Okay, so now we will explain more the correlation between the HIV and the COVID-19. Here are some description of people with HIV and risk of the COVID-19. And from the UNAIDS data, we can see that if the person with HIV is infected with the COVID-19, the severity of the disease will increase due to the comorbidities, of course, that they have. And these cases are more severe compared to people without HIV. And in most countries, it is also known that many people with HIV cannot access the needs to vaccinate for COVID due to the limitation of the supply of the vaccination drugs. And some countries difficult to getting access to go to the health facilities because some countries full lockdown and it's difficult to file vehicle to bring them to the hospital, and also difficult to accessing due to the very impossible situation at that time. So hereby, this is the information about the key approaches for the HIV prevention. Why I explained this before, because the first time for the key population or the vulnerable people with the HIV, it's important to make a good prevention, not getting infected for the HIV/AIDS. And this is, I think, we already understand about this, how to make the precaution from being infected for the HIV/AIDS. For male and female, for the sexual behavior, using a condom, testing, counseling for HIV and STI, and elimination mother-to-child transmission of HIV. So one by one, it's important to prevent from the infected of the HIV. And here in the current COVID-19 pandemic situation, everyone is at risk of being infected with the COVID-19, including those who are vulnerable to HIV/AIDS, of course, including women and children, women during pregnancy, women in their life cycle, reproductive health cycle, and people with HIV themselves. And considering that the vulnerable group, it's the population group that we have described in the previous slide, which is likely to be easy to get infected with HIV. And in the current situation, this vulnerable group will also be a group that is also vulnerable to being infected by the COVID-19. And we also know that is the vulnerable group is infected with HIV and COVID-19, of course, and the disease severity will increase. And in some cases, it was found that vulnerable group and people with HIV had a difficulty accessing the COVID vaccination that I explained before. Vulnerable group account for the possibility of an additional 65% of new HIV infection cases. But most of this vulnerable group are not the main target to get the COVID vaccination. And so from here, the focus is on the preventing possibility of being infected with COVID-19 and HIV in the same important point. So the important point one, the same how to prevent HIV and the COVID-19 itself together. And I tried to find some paper from the journal, international journal. So from this slide, we can see this is a kind of the cohort study from the New York. In this study on the severity of person with HIV if infected with the COVID-19, we can find this result. From this result means people living with HIV and infected with COVID-19 are a greater risk of suffering from the severity of the disease, and also increasing the risk of mortality. So that's why it's need to be careful, and it need to be addressed how to prevent the key population or the we call the vulnerable group not to be infected by the HIV and not to be infected the same as well as the COVID-19. And the specific risk for key population of the infected with COVID-19 is also the key population or the vulnerable group at risk of being infected with the HIV/AIDS. So we can see here, this is the member of the key population as well as homeless and or displaced people are at increased risk because of this additional comorbidities infecting their immune system. And it's difficult to access the health services, So it can reduce the ability to apply measures on confinement and social distancing, as well as generally limited access to health services and sexual behavior and drug use, including smoking. And people from the key population and people living with HIV are advised to take the same precaution as the general population for COVID-19 prevention. So there is the key point for this material. And here we already understand how to make a prevention being infected with COVID-19. And we hope that all of the vulnerable people already understand, and because it's important one, as well as they they need to protect themselves from the HIV infection. And this is the kind of management and prevention for vulnerable people according to the access to essential services, because during the COVID-19 pandemic, it's sometimes difficult to access the health facilities. That's why prevention management for people at risk with HIV/AIDS, which will increase the severity of disease if they are also infected with the COVID-19. So if we look at the important services to be able to access health services, like including this one, ensure that people from the key population groups which are affected by HIV are offered the same access to essential clinical services, continue without disruption. In this case, we hope all residents are facilitated as much as possible to get immediate service when they need it, especially in the pandemic situation like today, like now. And in some cases, for a vulnerable group, because of the pandemic situation, they have difficulty to accessing, like it's difficult to buy a condom, syringe to use for some drug user, and also medicine for preventing HIV infection. And for children and women during pregnancy in this pandemic situation, it is difficult to access the health facilities. So it is the critical that services that reach key population, such as community-based services. Sometimes maybe the government can prepare like drop-in centers and outreach services.
Ibu Gita.
Yes.
Maybe I just remind that your remaining time is still 4 minutes more.
Okay. Thank you very much. So this is the need to be addressed. It's important point. We need to ensure one more. We need to ensure the vaccination are up to date, especially for the children that living with the HIV patient, or the children that high risk for the become HIV, to make sure they will get the enough for the immunization. And for this, some cases for men's sex with men, we can be advised to do like voluntary circumcision to prevent HIV infection, of course. And we try to, in some cases where it's difficult to access, for preventing HIV transmission through sexual intercourse, such as a condom, it's difficult to find, and difficulties in the getting supplies of medicine. The increase in availability of test code and drug must be considered properly. And prioritize continuation of contraception services. So maybe I will go to this slide for the COVID-19 in the pregnancy. And in some cases, we find high-risk cases for the pregnancy people that living with the HIV patient. And it is necessary to pay attention to several preventive processes to avoid being infected with COVID-19. Although until now, data on pregnant women with HIV infected with COVID is still difficult to find. I try to find, it's difficult to find the correlation between the pregnancy during HIV infected and the COVID-19. But treatment of pregnant women with HIV infected, if we found with COVID, will get the same treatment as pregnant women who are not with HIV. So the same precaution, the same treatment. And in pregnant women with HIV who are infected with COVID-19, use an antiviral drug and a ARV regimen. It's important. And the use of drug must be with full attention and continue according to the condition of the virus in her body. And after that, especially for the children as a vulnerable people with the HIV, even though until now it's still difficult, the same like the pregnant mother, to find the cases of HIV/AIDS children in Indonesia, especially, because in South Africa, it's some research already published, explained about the correlation between children with HIV or children living with HIV people and getting the COVID infected. So it's need to be important management children with HIV in preventing COVID, but it's already a lot of the guidance, and I think WHO already published some guidance here. I put in this slide, so maybe after that you can open this guidance. Okay, maybe because the time, I just want to give some additional information for the not vulnerable HIV, but this is for the HIV. So people who have advanced or untreated HIV may benefit from additional dose of the COVID-19 vaccine. It's important to make sure they have enough protection against COVID-19. And for the people with living with HIV, so please make the contact with the health facilities as soon as possible. If you feel sometimes the COVID-19 symptom, it's important to give the information to them. Okay, this is the conclusion for my material. So improving HIV education in risk communities to reduce the incidence of new HIV infection, it's important. And reducing HIV-related health disparities in inequities, especially for access to get some drugs and the kind of the how to protect the people from the HIV, it's important. And reducing the incidence and severity of HIV-related disease by strengthening mother-to-child transmission prevention program and increasing the early use the antiretroviral therapy. We need to be careful and address during the COVID situation pandemic, because sometimes it's difficult to find the drug for the HIV. And increasing awareness of the continuing global threat of HIV-related disease and linked to COVID-19 outcome, of course, especially TB infection, because a lot of correlation between HIV and TB, and the COVID-19 with TB, it's become increased the severity of the cases. Ensure that maternal and child health services can be accessed easily at any time. And improving the health outcome of the people living with HIV through patient care, including COVID-19 vaccine, and research into improved prevention and treatment strategies for HIV and COVID-19, the important one for us to understand about it. Maybe because only 20 minutes, I prepare a lot of the PowerPoint here. Maybe after this session, the audience can open my PowerPoint to maybe make a little understand again about my explanation. Thank you very much. I return the session to the moderator. Assalamualaikum.
Okay. Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Gita Nirmalasari. Okay. It was very interesting and good speech. And then, ladies and gentlemen, all audience, just remind you, keep and prepare your question to all three speakers later. Okay, next you are going to the last speaker. Then we call to Mr. Muhsin. Okay, Mr. Muhsin will tell about the role of the Excellence Center of Science and Technology in mitigating and adapting to COVID-19 pandemic. And then I give you 20 minutes to give your speech. Time is your Mr. Muhsin.
Okay, thank you very much, moderator, Mr. Sohaimi. I want to present about the role of Center of Excellence for Science and Technology in mitigating and adapting to COVID-19 pandemic. Thank you very much. I introduce Muhsin, Chief of Science of Technology for Health of Polytechnic Padang. According to UNICEF data, there are 80 million children and adolescents in Indonesia facing in widespread secondary impact to pandemic, namely their learning process is hampered by education, health, nutrition, as well as protection. A total of 63 children become orphans, and orphans due to death of their parents due to COVID-19. This figure is estimated to continue to rise until Indonesia is free from COVID-19. Special protection is needed to children by separation from one and all both parents due COVID-19. I say to Indonesia, jelaskan, kita sudah tahu semua bahwasanya COVID-19 telah memberikan suatu dampak yang besar pada kelompok masyarakat, yaitu anak-anak, di mana anak-anak ini sebagai korban karena banyak kehilangan orang tua, baik orang tua laki-laki maupun orang tua perempuan, maupun korban pada anak-anak sendiri. Maka ini harus menjadi perhatian kita semua untuk bagaimana kita bisa mengatasi pada anak-anak yang kehilangan orang tua dan sebagainya. Nah, tentunya ini menambah peningkatan jumlah korban setiap tahun kepada anak-anak. Kita tahu semua di dunia itu ada sekitar 40.150 kematian. Nah, ditambah lagi dengan adanya masalah COVID-19. Untuk itu, ya, kita perlu sadari bahwasanya peran perguruan tinggi sangat penting di dalam mengatasi permasalahan-permasalahan kesehatan di negaranya masing-masing. Kita contoh Indonesia. Indonesia, the potential of Indonesia when the natural resource, the main capital to build the nation and state. Dan ini sebenarnya sudah diamandatkan di dalam Undang-Undang 1945. Bahwasanya the role of science and technology in all our nation building activities participants of university and development of human research, ability to increase the nation competitiveness through research and technology absolutely necessary. The assistance superior unit higher education is bridge to strengthen the nation competitiveness in general. Nah, perguruan tinggi harus bisa menjembatani permasalahan-permasalahan global sekarang ini. Nah, maka peran sains dan teknologi penting di dalam mengatasi permasalahan-permasalahan kesehatan sekarang ini. Seperti dijelaskan oleh Presiden Indonesia, instruction from the President of the Republic of Indonesia as the National Maritime Coordination Meeting on Friday, May 5, 2017, say that the winning country is the future is country that has the greatest growth acceleration, which is best supported by science and technology. Citing the center of excellence in higher education, science and technology is major need to support the president direction become winning country. Nah, di tengah permasalahan-permasalahan COVID sekarang ini, negara-negara, terutama Indonesia, harus menjadi pemenang di dalam mengatasi permasalahan-permasalahan. Ya, Presiden ini optimis bahwasanya Indonesia bisa keluar dari permasalahan-permasalahan COVID sekarang ini. Kenapa? Karena Indonesia memiliki perguruan tinggi yang mampu mengatasi permasalahan-permasalahan kesehatan, terutama COVID-19. Bagaimana? Apa peran? Apa sebenarnya pusat unggulan IPTEK? What is Center of Excellence Science and Technology? Is an institution organization unit of research, hygiene, education that already has research work. They are basic offering development new methods and are cross and multidisciplinary, which can apply through prototypes and pilot flight scale after going through the lab scale and begin to testing in more than one different condition. Nah, pusat unggulan IPTEK harus bisa menjadikan pilot project-nya pemerintah di dalam mengatasi permasalahan-permasalahan kesehatan, di mana memiliki beberapa multidisiplin ilmu yang bisa mengatasi permasalahan-permasalahan tersebut. Prinsip yang digunakan di dalam pusat unggulan IPTEK atau Principle of Center Excellence in Science and Technology is National Research Master Plan 2016-2045 and Focus 2017-2019 National Research is on disaster support-related nawacita program in the field disaster mitigation. The set has not yet produced and product. Nah, sekarang ini memang sedikit sekali program-program atau produk-produk yang lahir dari kegiatan-kegiatan pusat unggulan IPTEX. Nah, maka diharapkan melalui program pemerintah adanya nawacita yang memberikan penguatan kepada pusat unggulan IPTEX perguruan tinggi untuk bisa berpartisipasi dalam mengatasi permasalahan-permasalahan COVID-19. Apa yang menjadi karakteristik? Institutional characteristic of Center of Excellence is have a competitive advantage, has strategic value, transfer of technology and knowledge, strong and sustainable institution, become a national reference, world-class, and become the pride of nation. Institutional sharing of Center of Excellence is science and technology, is production sector competitiveness, availability of supporting factor, offensive and modern global life, and sustainable natural resource. So, main issue, saya akan nampilkan isu penting yang harus dilakukan oleh perguruan tinggi di dalam mengatasi permasalahan-permasalahan bencana non alam atau COVID-19. Beberapa hal yang menjadi isu penting. Global target pusat unggulan IPTEX is mortality, affected people, the related economic loss, damage to medical and educational facilities, DRR, disaster risk reduction strategies, support to development countries, and asset to elderly. Ini bisa ditujukan dari melakukan dengan memberikan suatu kegiatan diminta partisipasi penting dari stakeholder. Apa yang menjadi stakeholder? Role of stakeholder is civil society, volunteer community, women and children, academics, scientific research, artists and network, business, professional association, financial institution, and media. Ada 4 peran, ada 4 prioritas yang bisa kita lakukan di dalam mengatasi permasalahan-permasalahan COVID-19 yang diminta peran dari perguruan tinggi atau pusat unggulan IPTEX. Yang pertama adalah prioritas yang pertama atau priority 1, understanding disaster risk. Priority 2, investing in disaster risk reduction for resolution. Priority 3, strengthening disaster risk governance to manage disaster risk. And priority 4, enhancing disaster preparedness for effectiveness responses to build back better in the recovery and rehabilitation. Apa yang diharapkan? Apa yang akan menjadi outcome atau expected outcome dari kegiatan pusat unggulan IPTEX is the substantial reduction of disaster risk and loss in in health and economic, physical, social, environment, asset, or person, business, and communities and countries. Nah, kita berharap nanti perguruan tinggi dapat melakukan langkah-langkah di dalam mengatasi permasalahan-permasalahan COVID-19. Mulai dari prioritas pertama, yaitu memberikan pemahaman tentang risiko disaster, kemudian memberikan, meningkatkan pengurangan ketahanan masyarakat, baik keluarga, masyarakat maupun pemerintah, kemudian juga meningkatkan responsibility pemerintah, kemudian yang terakhir adalah bagaimana meningkatkan upaya-upaya rehabilitasi, recovery and rehabilitation. Main issues yang akan dikembangkan oleh World Research Center Leading Science and Technology in Handling COVID-19. Number 1, risk mapping of COVID-19 and risk group of elderly, pregnant, mother, and comorbid, and understanding the risk of COVID-19 disaster, increasing awareness of community and government COVID-19, prevention in fighting in risk management, improving the effective response to COVID-19 disaster, preparedness utilizing predictive technology COVID-19, risk reduction building recovery rehabilitation to COVID Tentunya kita berharap peran perguruan tinggi mulai melakukan upaya-upaya pemetaan risiko sampai menyusun suatu bentuk teknologi yang tepat nanti di dalam menangani permasalahan-masalahan COVID dan melakukan upaya-upaya recovery and rehabilitation. Thank you. Ya, thank you, Mr. Moderator, Mr. Suhaimi. Ini yang dapat saya sampaikan terkait dengan peran perguruan tinggi di dalam mengatasi, dalam mitigasi, adaptasi COVID-19. Thank you very much.
Okay, thank you for Mr. Moksin. It was interesting and good speech from Mr. Moksin. Thank you very much. Now coming to discussion session, and then I would like to all ladies and gentlemen, all audience, give your question to all three speakers. You can give your question by typing in your setting box or directly by raising your hand. Okay, ladies and gentlemen, we are waiting for your question. Ya, belum ada. Okay, ladies and gentlemen. Okay.
Can I have a questions for Mr. Musin?
Yeah. Pardon me, Mrs. Jularat?
Yes. Can I respond to how can I say his name? Miss Musin?
Mr. Muksin.
Yes. I agree with the last point that you have mentioned about that we have to have a plan for the recovery and rehabilitations. So can you give me more detail? How can we do that? How can we prepare for the recovery and rehabilitation plan?
Okay. Mrs. Chularat, you want this PowerPoint only?
Yeah.
Yes. Or just repeat your question?
Oh,
or your
yes.
statement?
I just want to Mr. Musin to give more detail about the plan for the recovery and rehabilitation for after the COVID-19. I think this is a very good point. So I just want to know his idea or his suggestion.
Okay. Maybe we'll...
Excuse me, Pak Suhaimi.
Ya,
barangkali Mrs. Kularat ingin lebih detail terkait dengan penjelasan Pak Musin terakhir, bagaimana rencana untuk rehabilitasi dan recovery dari COVID-19 ini begitu, lebih detail. Jadi minta penjelasan lebih lanjut. Oke. Sorry, I interrupt.
Yeah.
Oh, okay. That's okay.
Is it Indonesia language, Suhaimi, and translate Indonesia English? Yes, I say Indonesia language.
Okay.
Ya, terima kasih Mr. Chularat, Mrs. Chularat. Recovery and rehabilitasi memang kita lakukan sekarang ini karena memang penurunan jumlah COVID-19 terutama di Indonesia ini sudah cukup signifikan sekarang ini. Dan tentunya memang perlu ada upaya untuk menekan atau mempertahankan jumlah COVID-19 itu tidak meningkat lagi, tidak meningkat lagi. Nah, maka upaya-upaya recovery and rehabilitation.
Okay, Mr. Muksin, just step by step, and then I would like to Mr. Gusnedi to translate what Mr. Muksin is speaking about. Okay, please step by step.
Okay, thank you, Pak Suhaimi. So, Ms. Sulaiman, I would like to translate what Mr. Muhsin said. So, is it true that if you look at to the trend of COVID-19 in Indonesia now is starting to be flat, and the number of COVID-19 reduced by day. So, but we still have to do some effort in order to maintain these trends in the future. So next Pak Muksin, silakan lanjut Pak Muksin.
Ya, sedikit lagi Pak Ade. Jadi terkait dengan mempertahankan kondisi yang sekarang ini juga harus mempertahankan juga mental bagi penderita COVID, yang telah mengalami menderita COVID ini. Karena memang tanpa harus dilakukan suatu recovery, memang nanti kondisi akan semakin menurun. Ya, apalagi dengan kondisi perekonomian semakin belum bisa stabil, maka ada upaya-upaya peningkatan recovery ekonomi, mental dan fisik dari masyarakat tersebut, terutama kepada penderita-penderita yang pada masyarakat yang telah mengalami atau pernah menderita. Ini tentu akan terjadi suatu penurunan mental dan penurunan ekonomi, fisik dan lain sebagainya. Mungkin gitu Pak Gusnedi.
Please, Mr. Gusnedi.
Okay, right. So, Ms. Clara, Mr. Muksin explained that we still have to maintain the existing behavior in order to prevent the third or the second or the third wave of the COVID-19. So, the new normal area still have to maintain the current behavior in order to prevent more COVID-19 outbreak. And we also have to do some rehabilitation or recovery effort for those who affected by the COVID-19 before, especially for those in low economic status or the patient of the COVID that experience severe illness, and for example, and we have to do the recovery effort to recover the mental and then their condition right now. Okay.
Okay.
Good. Yes.
Okay. Do you still, Mr. Muksin?
Yes. Thank you.
Still.
Your question.
Okay, thank you. Maybe that is the explanation from Mr. Muksin by Indonesian language and translation by Dr. Gusnedi. Okay, did you get it what you asked for Mr. Muksin, Dr. Chularat?
Yeah, I think this is because I think this is very excellent idea. So we just like we work every day for fighting, protecting from the infection from the COVID-19, but we don't have to thinking if the COVID-19 in the good situation and what's next. So that's I think it is a good idea to have a recovery and rehabilitation or the plan for the next normal. So I think this is a good, excellent idea. I love it.
Okay, thank you, Miss Dr. Chulara. Okay, next we are going to next question from Lita Angelina. Okay, Lita, please, your question. Okay, Lita Angelina. Mr. Nico, can you open? Unmute for Mr. Lita. Okay, okay. Please, your question. Tell your name and to whom your question to be given.
I address my question to Mrs. Gita Masari.
Okay.
As we know, that the pregnant woman with HIV and COVID-19 has two serious medical problems. So my question is, number one, according to the latest research, how about the prognosis about pregnant women with medical problems such as HIV plus COVID-19 according to the latest research? And the second, can be pregnant women with HIV vaccinated with a COVID-19 immunization? And as a health professional, is there any aware that we have to know about pregnant women with COVID-19 complication? Thank you.
Okay, thank you, Mrs. Lita. And then directly I give to Ibu Gita Nirmalasari to
Okay,
answer
thank you
the
very
question.
much, Miss Lita Angelina, for the question. It's very, very important question because actually I had information in my slide, but there is no time to explain more. And in some research said pregnant mother with HIV, and if the pregnant mother with HIV getting infected with the coronavirus, so it's become severe illness, it's become occur. So for that important point is the pregnant mother with the HIV need to have some precaution, especially for the getting vaccination for the COVID-19 vaccination. It's important. And some research said until now for the decision to make the vaccination for the COVID-19, it's depend to that pregnant mother concern, but the health worker will advise to do some vaccination, COVID-19 vaccination to them. So I think the first and second question I told you here. And for the previous research, I found that for the pregnant mother with HIV, but they already under control during the treatment for the HIV. So the severity of the case is not so high like the pregnant mother not under control for the treatment or for the HIV. So the important point is for the pregnant mother with the HIV need to do some good treatment, especially for the control of the number of the virus load in their body like that. And because it's important point, so need to do some treatment, need continue to the treatment for the HIV, and then need to do some precaution for the COVID-19 itself. It's important point, and it's okay to get the vaccination of COVID-19, the same like the pregnant mother with no HIV, the same precaution. Okay, thank you very much.
Okay, thank you, Ibu Gita. Okay, maybe we are going to wait next question from audience, ladies and gentlemen.
So, or maybe if there is no question for the audience, can I ask for Dr. Chularat about the material?
Yeah, okay.
Thank you very much
okay.
For very, very good information about the children problem according COVID-19 pandemic in Thailand. I just curious about in your presentation, you mentioned about because the children in the rural area sometimes we found a very, very maybe poor situation, especially for the economic situation, and they difficult to join for the online class because maybe the family has not only one children but has more than one children. So is there a special strategy from the Ministry of Education, especially for the online class, that so every children can access, not even it's difficult to buy devices for that? So maybe some strategy you can explain and sharing to us. Thank you very much.
Thank you. This is a very good question. So at the first wave and the second wave of the COVID-19 pandemic, so we have an online class via television. It's like a long distance television program. So we just like schedule the program that such as from the early in the morning is for very, very small age of children. maybe start from the 8 to 10 a.m. in the morning. That's very small children, and then 10 to 12 or 10 to 1 p.m. is like kindergarten 6 or 2 to 9, and so it's like the afternoon program. So this is and then we ask the school to reduce some assignment for the children, and some course schedule. So reduce just as minimum as the requirement, not like the same level as before the COVID-19. So and then we can continue for the school schedule, for the semester. So, and then I think this is a very good strategy. And in some rural area, they can go to the school. We have a special classroom, so just a limited number, just only for the children that who need that, they can go to the school. So maybe we can have only 10 or 12 or 20. That's maximum number. Then they have to go to the school, because in their families, in their homes, they cannot have any devices that they can go for online class. So that's it. And this is very good strategy.
Okay, so the television program, it's like a national program.
National program. It's from the Ministry of Education. And some program is from the Loyal. Before that, we have a Loyal program, education and long distance television. So in collaboration with other organizations, other agencies, so we can have like a provide all day long for the television program for students.
Thank you very much.
Yeah.
Very clear.
Yeah, thanks.
Okay, thank you, Ibu Gita. Dr. Chularat, maybe more questions? We are going to wait. If no more, maybe before closing the second session, we are going to get a closing statement for each speaker. No more question? No? Okay. I think no more question. Okay, first I would like to give to Dr. Chularat. Please give your closing statement about our conference. Okay, time is yours.
Okay, yes. Okay, children are vulnerable group who are victims of the COVID-19, both direct and indirect ways. And because of some children cannot go to the school, and they are dependable group for the financial support from the parents. So COVID-19 make their health status and their social status like getting worse. With the strategy, no children left behind. So children can be a key actor in fighting with COVID-19 and other harms by enhancing their ability, enhancing their self-efficacy and resilience. Then they can transfer this ability to enhance other health literacy. It means that children can help others too. So to welcome a success, we have to do this with the collaboration with a network from the government agency and not government agencies, with the collaboration from the community and school. So thank you very much.
Next, we are going to call Ibu Gita.
Yes,
please
okay.
give your closing.
Okay, thank you very much for this very good event today. Especially my material, sometimes it's a little tricky because we need to make the good correlation between HIV people, vulnerable people with HIV, and people living with HIV, and togetherness with the COVID-19 prevention. So according that, we need to be careful and make the same precaution. And there is no like the first level or second level. No, not like that. So the important one is the make prevention together between how to prevent from HIV and how to prevent COVID-19 itself. So it can be better, and every vulnerable people we can we can addressing that they can get access to have the facilities to get vaccination of COVID-19 and to what is that to how to prevent from the HIV/AIDS. I think only that the conclusion for my presentation. And thank you very much for the Poltekkes Padang for this.
Okay, thank you Ibu Gita. Last speaker, Mr. Moksin, closing statement.
Ya, terima kasih Pak Suhaimi. Jadi maka melalui perguruan tinggi kita berharap akan lahir produk-produk berupa sains, berupa teknologi yang bisa untuk mengatasi permasalahan-permasalahan COVID sekarang ini, meningkatkan upaya-upaya kita dalam meningkatkan ketahanan masyarakat. Nah, yang sangat terpenting yang diharapkan sekali pemerintah adalah bagaimana kita bisa perguruan tinggi bisa berkolaborasi untuk menemukan vaksin-vaksin yang efektif yang terbaik untuk bisa meningkatkan ketahanan atau preventif ya, peningkatan preventif bagi masyarakat. Mungkin itu saja Pak Suhaimi.
Okay, thank you, Mr. Musim. Maybe we are coming to the end of our conference for the second session, and I'm Suhaimi as a moderator. Would like to forgive me for all mistakes during my task as a moderator, and then I would like to thank you for all speaker, Dr. Chularat, Ibu Gita Nirmalasari, and Mr. Muks. See you again. Bye-bye. Assalamualaikum warahmatullahi wabarakatuh. See you.
Bye-bye.
Again.
Bye-bye.
Okay. Just give applause. Okay. Just give applause.
All right, thank you. This is the end of the second panel. We would like to say thank you very much to the speakers and also to the moderator. What a great discussion. And ladies and gentlemen, we will break for a while and we will be back at 1:30 p.m. still in this Zoom meeting. Thank you. See you.
Excuse me, Ms. Rafi. Excuse me, Ms. Rafi.
Yes, Mr. Gus.
Yeah, maybe we have to announce to all participants to come back to the Zoom meeting at 1 o'clock, and we will be divided into 4 rooms or 5 rooms for the oral and poster presentation.
Okay.
So, yeah.
Yes, thank you for the information. So, as stated by Mr. Gusnaidi, ladies and gentlemen, please, we will be back at 1 p.m. At 1 p.m. still in this link Zoom. Thank you.
Bye.